Good morning.
Good morning.
Welcome to the Greater Boston Health and Wellness Fair. This fair is being brought to you by a number of chambers of commerce around the area. We've got Arlington, Lexington, Malden, Melrose, Stoneham, Waltham, and Winchester. I am Erin Sandler-Rathie from the Lexington Chamber of Commerce, and I have with me right now Dr. Glenn Daddario, who is with HD Physical Therapy. He's the founder and owner of HD Physical Therapy with locations in Wakefield and Burlington. So good morning.
Good morning. How are you?
I'm well, thank you. Today, not in need of physical therapy. But I have had physical therapy in the past and it has been really beneficial. So tell for people who haven't had physical therapy, what are some of the benefits that they get out of physical therapy working with you?
The biggest thing people come in for really is, pain relief. Something's bothering them and it's painful. So, number one is trying to get the pain levels under control or lower or resolve them completely. But then beyond that, we're also, we're the type of healthcare professionals looking at getting people moving better and feeling better and getting back to all the things they want to do. That's really our ultimate focus, is restoring function. But people can come in with a complaint of pain, but we're looking at reducing that pain and getting them back to the things they want to do, whether it's, work or their recreational activities or just, playing in the backyard with their kids.
Yeah, exactly. Well, and that's what today is all about, right? We put it as our mantra for this whole fair: move a little more, eat a little better, stress a little less. So it sounds like, that's exactly what you do when you're working with your patients.
Exactly. Yeah. That's what we try to achieve.
So I think that then I may have a misperception that physical therapy is after you've had an injury, like you dislocated your knee and your doctor prescribed 6 weeks of physical therapy or whatever. But can people self-refer when they have just an issue that they're experiencing?
They can. We're fortunate to be in the state of Massachusetts where we have something called direct access, which is very important for physical therapy providers, which does allow a patient to have any ache or complaint or just want to feel better, or even some preventative care as well. They have the ability to just call the office and schedule an appointment. And that's not the case in all states, but it is in Massachusetts. So it's something we try to make people aware of, because sometimes they are waiting to see a doctor first and, get a script, and that can take a long time. And that can be weeks then before you get in an office, where you can just call us and we can get you in right away.
That's really good
and get
to
you
know.
covered.
Okay. So what differentiates your practice from other physical therapy practices around the area?
We focus on getting one thing, getting patients in fast for that same reason. We know sometimes people do see a doctor first, and that can take a few weeks, and then to get the referral and then to schedule. And then by then they could have sprained their ankle or had acute back pain. And now it's like 3 or 4 weeks before they're getting in to see anybody for treatment. And we really try to have some techniques, our scheduling, which allows people to get in, as soon as possible. And we really try to focus on getting people in within 24 hours of that initial phone call.
Oh, wow.
Try to take care of all.
Quick.
Yeah, I mean, when people are in pain, they want to get better fast, obviously, and we don't want to tell them it's going to take multiple weeks to get them in. So, again, we structure our schedule in a certain manner that allows for quick scheduling and easy access for the patient. We also handle all insurance issues for the patient. So, if a patient does need a referral, we have people who can do that, so the patient doesn't have to waste time on the phone hunting down a doctor, and they ask for additional information that they're probably not going to have. So we take care of all that. And then treatment-wise, our treatments are focused on evidence-based practice. We do believe in a combination of hands-on therapy, where you're going to get your short-term pain relief from. So we have various manual skills and modalities that we'll use, and in the long term, and we believe in the long-term lasting effects is going to come from the stretching and exercise program. So we use a mix and match of both kind of systems there.
Interesting. Okay. What's sort of your favorite part about working with a patient? Do you have some success stories?
Just always, I think that's why we all get into the profession, is, to help people and watch that, PT is a healthcare profession that you get to start with the patient and see them through their care, at least in this outpatient setting. So, I mean, it's kind of cliche because I think most therapists would say this, but it is true that when you see someone come in and, in a lot of pain, or, they can't move their arm above their head or whatever it is, and you get to take them through that process and see them achieve the goals in the end, it is, it's very satisfying and very rewarding to see that. And most patients are pretty appreciative of the care you provide. So, it's a rewarding profession and experience that way.
Are you doing telehealth visits right now?
We are. We do offer telehealth during this. Obviously, we never did until obviously the pandemic hit. It wasn't something we really ever explored or really ever felt we had the need for. But since the pandemic, we have gone into telehealth. So that option is available for people who don't want to venture into the clinic right now.
And how do you work with a patient? As you said, you do a lot of manual manipulation and you have techniques for that. So how do you replicate that experience in a telehealth visit?
You can show them various stretches and exercises that can help. And there are, if they have a few very simple tools or things around the house, there are ways you can teach them to kind of use, you can get the kids' soccer ball, tennis ball, a golf ball, stuff like that around the house that you can teach them how to, maybe do some self-massage or self-mobilizations with. And we have had a lot of success walking people through that process as well.
So I think that's one thing people might not realize about physical therapy is there's homework. Right? It isn't just the part where you're in the office. You have to be doing the work on your own. You
do. I mean, a lot of people, we set up when someone comes in for an evaluation, and we go over everything, you're typically going to start coming to therapy 2 to 3 times a week. And then, the goal is to tailor down. So you're coming into the clinic less and less. But I mean, if you think of it, if you have a severe injury and you're coming to therapy only 2 days a week, is that really enough to make true gains? Typically, sometimes you get lucky, sure, but ultimately they have to be doing stuff on their own too, on those off days to really see the gains and to maximize that efficiency in their recovery.
Yeah. The physical therapist I have worked with before said that there's a saying in the physical therapy community, motion is lotion. And what she was saying was that when you're in pain, you have a tendency to not want to move that joint or that muscle, right? Which is, so it's counterintuitive that what's actually going to make you feel better is moving it more.
That's hear it all the time. People will say, if something hurts, they typically, I don't know where this came from, but just don't move it or rest. And that is typically, research has found over the years, that's typically not the best advice, other than maybe like a day or two. But beyond that, you want to be as active as you can with overall and within whatever body part is bothering you, to the point of that it's not making it worse. Mm-hmm. So if you can move your arm if you can only move your arm to a certain point, you want to keep it moving to that point, without causing more pain to make sure it does stay as loose as possible. Yeah.
Yeah.
The more you lay around and rest, typically your muscles are going to get tighter, stiffer, and the muscles are going to get weaker. So then when you try to get back to whatever activity you're trying to do, it's just going to feel even worse. So it's usually a false sense of security with that old technique or mindset.
So it's sort of a temporary relief from pain, but you're really not solving the problem.
No. So your therapist was dead on correct there. Yeah, you want to move as much as you can without making it worse. Is the answer.
Can physical therapy help with non-muscular issues like migraines, for example?
Yep, sure. We treat all sorts of headaches. There's techniques. If you find there are certain restrictions within joints in the neck or the mid-back or the shoulders, or there can be joint restrictions, soft tissue restrictions, range of motion issues, strength issues that all contribute to various types of headaches or other symptoms like that. And we have techniques for all of that.
That's excellent.
Other ones that people don't think of too are like TMJ or jaw issues or vertigo. And those are also, things that we can treat in the outpatient setting as well.
Interesting. Okay. So it's a lot more, there is a lot more to physical therapy than just I injured my knee and now I've got to go do a couple weeks of this. It's something that it sounds like most people could probably benefit from.
I might be biased, but absolutely.
How many therapists do you have working with you between the two offices?
therapists in our Wakefield office and 3 physical therapists in our Burlington office at the moment.
Oh, wow. Are you expanding further around the area? Do you have plans?
Not at the moment. Right now, we're settled into Wakefield and Burlington, and Burlington's 3 years old, and our Wakefield office will be 9 years old this April. So,
congratulations!
Thank you, appreciate that. But I mean, we don't have any. We could expand. We could stay happily where we're at, but kind of time will tell on that one. No immediate plans.
Well, it's nice to know that sometimes I think when we see more than one location of a business, you start to wonder whether it's a franchise or something like that. And it's important to know that you're locally owned and operated. You have these 2 offices. It's not a large chain. So you can really give individual attention, and you understand the demographics of this area and the kinds of patients and the kinds of injuries that happen in this region.
Yeah, I appreciate that. Thank you. We do. And, that's a big part of it is, having the control over it. Our quality of care is, nothing's more important really than the quality of care that the patient's receiving, that they're having the best experience. And our ultimate goal, we like to have fun in the clinic and joke around and laugh at each other and all that stuff too. But our number one goal is always to get patients better as fast as possible, as efficiently as possible, and make sure they have a great experience. And being directly involved in the patient care, I carry a full caseload. My business partner carries the caseload, so we're directly involved in the care every day. We're interacting with our therapist every day, and we're right in the business, seeing how it's operating every day. So we do have a good sense of what's going on at all times, which does allow us to, in my opinion, give a very high level of care.
Absolutely. Right. No, it's very important as you wear those 2 hats. You have the business side of things, and then you also have the actual therapy delivery. And as a business owner, you have to maintain both of those. So like most small business owners, you're juggling a lot.
Very true, yes.
How have you coped over the past year? What's it been like for you?
There have been some challenges that we've kind of rolled with. It was obviously a little difficult when the pandemic first hit. There were a lot of unknowns at that time. No one knew, people didn't know if it was safe to come out or not come out. We didn't know if, there were rumors that we were going to be shut down, and we didn't really know it was tough to plan on scheduling, and for the patients, it was tough to plan on staff scheduling. But, as it rolled on, we got more answers, and we were able to kind of downsize the practice temporarily for a bit. And we were luckily put on the essential list, so we never did have to close, which allowed us to treat patients throughout that phase, which was important because a lot of patients had just had surgery prior to that pandemic. And, they were very concerned that they weren't going to be able to get the care they needed post-operatively. So we were able to stay open. And then as the different phases progressed, we were able to kind of slowly reopen, different phases of the business, bring more staff back in, and then kind of open our schedule back up to normal. But yeah, there were some ups and downs and some challenges throughout that process. But we have a great staff, luckily, and a great support system and a great community and great referral sources. So that all is very helpful to get back on our feet.
That's great. No, we're very glad that you're here, and I'm sure your patients were very appreciative that you didn't have to close during even the initial stages of the pandemic. So I know I have to let you go in about a minute, but is there any, I'm going to ask, since we're all sitting in office chairs a lot, and I'm sure you're seeing those kinds of new complaints, right? Is there
daily
favorite stretch that you have that we could be doing to all improve our lives at home?
I don't think a favorite stretch per se, but I would definitely say if you're sitting, if you're stuck at home, sitting all day, definitely be aware of taking some breaks and I tell my patients all the time, put a sticky note or a Post-it note on their computer to remind them, or set a reminder in their phone. So every 15, 20 minutes, they just stand up. And even if it's just a 30-second standing break, it just helps unweight your spine and get your joints moving a little bit, even if you walk around the dining room table 2 laps and then sit back down again. But staying in the chair for 8 hours a day is definitely can lead to some imbalances.
Yeah. Yeah, we feel it. We feel it
Yeah.
back, neck, shoulders.
You're not sitting in your fancy office chairs anymore either. It's like you're sitting in a kitchen chair or dining room
Yeah.
chair, and which aren't built for that sort of thing. So we've seen a lot of that in the clinic over the last few months.
That, and I think one thing people don't realize is the work surface height. Desks in offices are ergonomically designed, which sounds like just a label that they put on it, but really the height of the work surface and the proportion of that to your chair and so forth in office buildings is calculated and calibrated for people sitting there and working.
Absolutely. And it's obviously a dining room table and kitchen chair, or you sit at the island, on a high stool and you're looking down all day, it can take a toll eventually. And people are working longer hours, it seems like, too, is a trend I've seen now that they're working from home. So they're stuck, sitting even longer throughout the day. So I think just standing up every 20 minutes, 30 minutes and taking a quick standing break can do a lot of good.
Well, Glenn, I want to thank you very much for doing the live stream with me this morning. Thank you. You're going to be in your booth the rest of the fair, right? So people can come by and ask you more questions right there.
Sure. Sounds good.
Excellent. Thank you so much.
Great.
I wish you luck with the practice. All right. So coming up, we actually have Cho Greenwater, who is right there. Hi, Cho. Nice to meet you. And Cho is going to be leading us through a body and brain presentation. Tell me what that entails.
Body and brain, this is actually a training with working with energy. Within our body, we have a natural healing energy within us. And there are so many different types of exercise, and this is working how to awakening this natural healing energy through stretching, tapping, twisting, all different ways.
So it sounds like it complements what we were just talking about with Dr. Daddario and the physical therapy. What type of person would seek out your services?
Actually, anybody. I just had a one-person meeting. She is just a mother, and she is expecting having a baby. She has a hard time having a baby, and I just explained to her that the core area is everybody knows how important it is, but usually a lot of a problem in our body is coming from energy is not balanced. Like for example, if we are sitting for a long time, without moving the legs, without moving the lower abdominal area, then so many body temperature drops and naturally body become weak. And so anybody who at any age need any form of exercise, because we do very simple exercises. So that's why anybody who I need to do something that is anybody can do this.
How do you learn to use the energy or connect with the energy in your body so you can rebalance it?
Right, because actually we are using energy all the time, but we forget about the energy. Like for example, even I'm speaking, even I blink my eyes, it is actually energy is doing the job. But we are using energy all the time. We forget about this energy, just like we are breathing, we forget the oxygen. And that's why we start from the feeling the energy first. Feeling the energy, and then how to, we feel sometimes if we have a shoulder pain, that's where the energy blockages are. So we do very simple motion. So it's not something difficult or complicated, very simple exercises that helping the energy flow better. And that's what we are guiding.
That's very interesting. So when patients come to you or when clients come to you, what's a very typical complaint?
Usually these days anxiety. Anxiety and nervousness, sleeping problem, and the headache, lower back pain, or some people have come with a serious problem like a cancer, fibromyalgia, and things like that.
Sure. How do you work with them if it's a complaint like headaches or anxiety? What's the connection there? What's the blockage for something like that?
Yes, within our body we have energy channel is called meridian channel. Meridian channel is energy is flowing all over our body, but there is one most important meridian channel, which is energy is flowing this way, coming down from in the front, going back up. Energy is flowing, but usually what is disrupting this energy flow is stress. And whenever we get stressed, anxious, energy going up instead of energy coming down. If the energy going up, then what happens? Usually eyes get tired easily. Some people have a dry eye, dry mouth. But people not pay attention. They just put in the eye drop. But that is a sign that energy is going the wrong direction.
Okay.
And then if energy stay up in the head too much, then it can cause a headache. And then it making people nervous, anxious. Even I don't want to feel nervous, but it make you more nervous because of stress.
Yes, exactly. Well, that's exactly what anxiety does to you, right? You feel it and then you don't want to feel it, so then you worry about feeling it and it keeps going.
Right. It is a heart chakra. Heart chakra is very sensitive to the stress. The moment we get stressed, the heart chakra is blocking, and then energy going up, and then a lot of symptoms coming up in the head.
Okay. So how do you reverse that energy flow then?
Yes, very simple exercises. Usually we pay so much attention on the back because our back is we sitting, like for example, sitting in front of a computer all day long. The back becomes so stiff like a tree. But a lot of people, they don't realize it because very gradually. But we recommending, just like the person, I don't know his name, the previous, every 1 hour, like a move body a few minutes. Because otherwise we forget how much attention we holding inside. So every 1 hour, we call it 1 minute exercise. Every 1 hour, we give some kind of home exercise to reminding them. Another thing in the studio, we are doing all those exercises to loosen up the tight muscle in a very simple way to open up the energy channels. That's what we do. Mm-hmm.
So when my Fitbit buzzes on my wrist and at the 10 minutes to every hour, it's telling me I need to get so many steps to finish out the hour. But that's also a good reminder just to get up and move, right? To do some of this, don't just stay there, even if you're not going to get the 250 steps.
Yes,
get up
that's
and
right.
do something.
What I teach you, the most simple exercise I teach is we call that intestine exercise. Move our intestine. This is actually very important for most people. Moving the intestine in and out, in and out. I do this while I'm driving a car.
Oh, really?
And then, yes, I do this while I'm watching TV, while I work in front of a computer, because our legs is not moving. If we don't move our legs, the circulation through the legs become very weak, in creating the cold hands, cold feet. But if we're moving intestine in and out like that, it pumping the blood, it pumping the energy. People who have a lower back problem, usually the problem starts from the intestine. If an intestine is tight, bloated, or weak, some people feel the pain in the lower back. So that's why I encouraging them to do the intestine exercise, like a 5 minute, 10 minutes. Then you start getting warm. And then you feel more relaxed and more energy.
Excellent. Do you have anything you can demonstrate for us?
If we have a time, that we can do a simple exercises that create the mindfulness, and that is something that we can do. Is that okay?
Yes, please.
Okay. So let's do sitting. The first thing, make a fist, and then slowly 2 inches below belly button, tapping very gently. And then relax the shoulder and move the spine very gently. Okay. You can move front and back or side to side, move your neck, and then gently move your spine too. Okay. And tapping your second chakra. Second chakra, lower abdomen, we call core. second chakra is where the energy is supposed to be gathering. But when we're thinking, a lot of energy is there in the head. But when you stimulate there, slowly energy is coming down. So usually people who has anxiety, mind doesn't stop, it's keep going and going. So instead of following the thoughts, stay in the feeling. Okay. Stay in the feeling. Let's do for 30 seconds.
Okay.
Relax the shoulder. And stay in the feeling with the eyes closed. And then exhale long. Yeah. And that is a pure awareness. This awareness watching my body condition, where is it tight. And as I exhale, relax all the tension. And now slowly stop, put your hands on the knee, and then just relax and scan your body. And then slowly, I want you to raise your hands and tapping your fingertips. Each fingertip, that is a gate where the energy enters and energy leaves. So tapping the fingertip and relax your shoulder again. Yeah. When we're thinking so much, all our energy, healing energy, leaves, scattered. So bring your awareness to your fingers. Bring your awareness in your fingertips. Just 10 more seconds. Tapping. And slowly stop. And slowly, very slowly open and close. But do not touch. And just focus on your hands. Then you can feel like a magnetic sensation, tingling. Just stay in the feeling, not in the thinking, but in the feeling. And you can imagine you are wearing like energy gloves around your hands. Just about 30 seconds. Relax. Just feel the magnetic sensation or tingling. This is your healing energy. Even tiny sensation is okay. Just keep feeling. And then slowly bring your hands down in front of a second chakra, lower abdomen, and relax the shoulder. And just watching your breathing 5 times. And give yourself time to relax. And just watching your breathing. Slowly inhale and exhale. I think it's time. So you can open your eyes. I don't know if you feel the energy, So using this energy sensation, we are going inside and we are awakening the peacefulness within us. And that's what we are guiding step by step.
Thank you so much. You're absolutely right. I feel more at peace. I could feel when I was bringing hands together, you can feel, it's like
Yes.
there's something there. You can feel
Yes.
that.
Right. Yes. That is energy. The energy is a healing power. If our mind is busy, this healing power naturally become weak. But if you bring your awareness to your body, then this healing energy expand. But most people, they don't feel it because we don't pay attention to it. But if you focus, you can feel that energy is surrounding. And that's how you have to awaken that energy. And eventually you have to learn how to accumulate that energy in the second chakra. Yes.
Thank you so much, Cho. This
Yes.
has really been wonderful. And will you be in your booth later?
Yes.
Okay, wonderful.
Yes.
So people can stop by and maybe do a little demonstration with you as well.
Yes.
All right. Thank you so much.
Thank you. Yes.
So next up, we have the science behind COVID with Dr. Gary Krakoff. And I believe he has a presentation for us. Good morning, Dr. Krakoff.
Good morning. How are you today?
I am well, thank you. So you are, from what I understand, you're a registered pharmacist with a doctorate in naturopathic medicine. Is that right?
That's correct.
And your business is Johnson Compounding and Wellness.
Right. And we're at 577 Main Street in Waltham.
Perfect. Okay. Excellent. So tell us a little bit about what you're going to present for us today.
Well, there's a lot of conflicting information out there about COVID and supplements to take, and there's good information and terrible information. And so the presentation is based on the science research. East Virginia Medical School has done a lot of research and has put together some protocols for prevention, for treatment that includes over-the-counter products. And so this is real science-based. There's proof that these do help. And I'm also going to talk a little bit about the vaccines and what you can do when you get your vaccine to help with some of the reactions we get. The reactions, for the most part, are really positive. That's the body responding, but you don't have to suffer. There's some nice supportive things you can do.
Okay, excellent. Thank you. So I will invite you to go ahead and show us your presentation, please.
Okay, give me 1 sec to get things rolling.
Yeah.
And we're going to go with... All right, so welcome and thank you all for joining. I'll be talking about COVID-19 and the science behind natural approaches. There's a lot of information on the web. Some of it's good and some of it's not so good. COVID therapies are evolving daily, and we're seeing from last year to this year, as we have more experience, there's more data that we can show what and prove what's helpful and what's not. So please be wary of some of the posts that claim a magic bullet or this product protects everyone from COVID. That nothing is 100%. We're each unique, and viruses have a way of attacking our weaknesses in each of us. This is why some very healthy people get very sick from COVID, and some health challenge people can have a very mild case. Lifestyle, health conditions, and genetics are some of the factors that contribute to our resistance to COVID and our reaction to the virus if we get sick. There's a lot of research going on into treatments, preventative measures, and even looking for genetic susceptibility. So what's not recommended today may be recommended soon, and what we think is a good therapy today may be proven not to be as effective down the road. Also, due to each of us being unique, the therapy for each person must be individualized. We now realize we realize this now in the hospital setting, that some of the very sick people There's genetic and lifestyle reasons for it, and we really need to be treating a person with COVID, not treating a COVID case, because the individualized treatment is working so much better than trying to find or use one or two treatments for everybody. So there's a lot of information, like I mentioned, on the web, what to take, what works. East Virginia Medical School has published protocols that include supplements. They're science-based, and it's consistently being updated. It's a living document as new information is gathered. I put the address at the bottom, and you can download this PDF. They have protocols to take prophylactically for prevention if you're not sick. They have protocols if you have a mild case, but you're not hospitalized. And they're even using some of the natural products in the hospital for the very sick people. These protocols include vitamins, supplements, and pharmaceuticals. And again, there's the link for you. I also have this whole presentation on our website, naturalcompounder.com, in the blog section. So if you want to come back to any of these slides, they're all up there. So the protocols that we'll be talking about are for pre-exposure, for prevention, if you were exposed to someone who had tested positive, early treatment, and even in the hospitals. And here's a couple of their protocols from the East Virginia Medical School. The top one, the prophylaxis, if you look at it, it has vitamin D, vitamin C, quercetin, zinc, melatonin, and I'll go into each of those and why they're there and why they work, what the science is behind it. Ivermectin is a prescription drug, so if you're interested in that, you do have to talk to your doctor. Okay, as you saw in that list, melatonin as well as quercetin, vitamin C, vitamin D play an important role in both pre-exposure and post-exposure. All the medications in their protocols are readily available, proven safe, and are very inexpensive. So there's no magic bullet, no single drug therapy on the prescription side that'll be effective for a disease like COVID. Our genetics, epigenetics, and pre-existing conditions and lifestyle make each case different. Some people will have a cytokine storm and may wind up on a respirator. Other people are positive and have no symptoms. Some it might feel like a mild cold or flu, and some become long haulers. They're finding 40% of people that get COVID have residual symptoms, sometimes for weeks and sometimes for 6-8 months. So each case has to be looked at as an individual with COVID, not a COVID case. Having a pulse oximeter around the house can be very helpful. The lungs can be seriously affected, and that's where the cytokine storm hits. If you have any breathing issues, you should be checking your oxygen levels, and that can be very helpful and can be life-saving. The oxygen levels should be in the upper 90s. And over the year, they found if you're testing 94 or below with just walking around with minor exercise, you should get in touch with your doctor or go to an emergency room, because people whose oxygen level drops below 94 and have COVID seem to be statistically at a higher risk of winding up with really bad lung or heart problems and being on a respirator. And you want to make sure that you put the oximeter on your finger, let it run for a while. It'll give you an average. You don't want to just do it for a few seconds. So here's EVMS's, the East Virginia Medical School, recommendations for people with mild symptoms, but they're able to be at home. They're not hospitalized. And none of these are huge doses. Vitamin C, 500 milligrams twice a day. Quercetin, 250 to 500 twice a day. An absorbable zinc, 75 to 100 milligrams. Melatonin, 10 milligrams at night. 2,000 to 4,000 units of D. And a low dose or regular dose aspirin, because we're finding Aspirin has anti-inflammatory, anti-thrombotic, and it supports the immune system. And they're finding that a lot of people with COVID start having clotting problems, and also vitamin, the B complex. So talking about vitamin D, it's very, very important. If your level is low, the people with low vitamin D can benefit on the immune side the most, getting your vitamin D level up to around blood level of around 60. And studies have shown that vitamin D insufficiency has been associated with an increased risk of getting COVID and from dying from the disease. And they found residents in long-term care facilities who vitamin D level was low and took vitamin D supplementation had a much lower risk of dying from COVID. The former CDC chief said the coronavirus infection rate may be reduced simply by using vitamin D. We all know Linus Pauling and all his studies of vitamin C and how helpful it is. Vitamin C is an anti-inflammatory. It helps boost the immune system. Quercetin, which is part of the vitamin C complex, has a direct effect. It's antiviral. It can help kill viruses, including the SARS-CoV. And it's also an antioxidant, which is very helpful. It's water soluble, and any excess will flush right out of the body. We think of melatonin mainly as a sleep aid, but it is much more. It has a positive effect on our immune system in relation to COVID-19. It's anti-inflammatory and antioxidant. It helps modulate the immune system and some of our metabolic effects. And they're finding that taking that can be very helpful in prevention and also in treating COVID. Zinc, we hear a lot about zinc sprays and zinc lozenges. You want to make sure that you're getting an absorbable zinc. Some zinc formulas are more irritating to the stomach than others, but 30 to 50 milligrams of elemental zinc can be very, very helpful. And zinc is also a cofactor for an enzyme that fights directly the SARS-CoV virus. So it supports our innate and our adaptive immune system, and I'll talk about that in a few slides. And again, 30 to 50 milligrams. Here are some of the studies on the importance of B complex. We use more B vitamins when we're stressed, and they're critical in many metabolic pathways necessary for a healthy body and a healthy life. They're necessary for detoxification, methylation, and many other metabolic pathways in our body. Now, just a warning, a lot of people feel if they're starting to have trouble breathing, taking a steroid inhaler, or if you have some prednisone left over, which you shouldn't, you should throw it out if you didn't use it, that taking that will help you breathe better if you're starting to have some of the lung symptoms from COVID. But in the early stages of COVID, the viral replicating phase, corticosteroids increase viral replication. So in other words, it can make your case of COVID worse. So you shouldn't take any steroids, whether they're inhaled or oral, without checking with your doctor. The flip side of that is if someone's using steroid inhalers for asthma, don't stop taking it if you think you have COVID without checking with your doctor first. So a little bit on the immune system. Everyone's immune system is different, but as a rule, it becomes stronger during adulthood because by this time, we've been exposed to more pathogens and developed more immunity. This is why teens and adults tend to get sick less often than little children. Once an antibody has been produced when we've been exposed to a virus or a bacteria, a copy remains in the body. So if the same bacteria comes along again, it can be dealt with quicker. This explains why some diseases, such as chickenpox, you only get once, because the body has a chickenpox antibody stored, ready and waiting to destroy any chickenpox virus that comes back into the body. This is our immunity. Immunity can be broken down into innate and acquired, and then the acquired into active and passive. We're born with our innate immunity. It provides general defense against common pathogens, which is why it's also known as the non-specific immune system. This is the rapid response system, and it's the first to respond when an invader is identified. The cells of the innate immune system surround and engulf the invader. The invader is killed in the immune system by phagocytes, a specific cell in our system. The adaptive immune system can target specific threats against viruses and bacteria in the body that it has been previously exposed to. With help from the innate immune system, it produces antibodies after the body has been exposed to the invader. It can take several days for these antibodies to develop, but after the first exposure, the immune system will respond faster. And our passive immune system is borrowed from another source, but it doesn't last indefinitely. For instance, a baby receives antibodies from the mother through the placenta before birth and in breast milk following birth. This passive immunity protects the baby from some infections during their first years of life. So knowledge is constantly changing. In March of 2020, we thought the ACE2, which is a blood pressure medicine, inhibitors were dangerous if someone had COVID. Now, with more data and research into genetics, we realize the ACE2 inhibitors can be helpful for some people. COVID-19 binds to the ACE2 receptors on platelets, leading to an increased clotting in some people. And that was one of the reasons, if your doctor says it's okay, that using low-dose aspirin can be very beneficial in the early stages of COVID. COVID also inhibits the ACE2 enzyme, which can lead to more inflammation in the body and the increased risk of a cytokine storm, which is what really inflames the lungs and causes a lot of people to wind up on respirators. Now, another growing issue, because we're getting more data, is the long haulers, the people who have COVID and they're testing negative and they just can't get rid of all the symptoms. They can be tired all the time, headaches, painful joints, trouble breathing, chest pains, cognitive dysfunction. Up to 50% of patients are experiencing the long haul syndrome. So it can be for months, and some people are even going 6 and 8 months. The neurological symptoms may be related to micro clots in the body, which can affect the lungs and the brain. And so that's why, if you think you have COVID, it is very important to touch base with your doctor. Don't just ride it out at home without keeping touch or in touch with somebody, your doctor, or an emergency room, or even one of the walk-in clinics, because a lot of people don't have the clotting problem, but if you start developing it, catching it early can be a lifesaver. Now, I'd like to talk a little bit about misinformation. With the pandemic, there's so much information on the internet, and one of the problems is, especially with social media, things take on a life of their own. So something may get posted by somebody you know who you trust, and they got it from somebody they trust, and pretty soon it's on Facebook or Instagram or Twitter. You know, you see it 50, 60 times, so it must be true. So you really have to follow the thread and look at the source of the information, the original source. You want to read the news and information from reliable sources, not be online and checking 24 hours a day. Watch the news a couple of times a day to get caught up. Stay connected with positive people. Have a plan for staying in touch with family and friends. The isolation has just as much of a negative effect for some people as a mild case of COVID. You want to hang around with positive thinking people and limit your contact with the worriers. Isolation can cause us to ruminate, and the anxiety and the stress just keeps building. And the more you're on social media and the more you have the news droning in the background 24 hours a day, the more the anxiety goes up. And there's nothing wrong if you're getting overwhelmed to seek help. That's a positive thing. Really concentrate on the things you can control. Wear a mask when you're in contact with others. Keep social distance. This slide is 6 feet. It looks like the CDC is changing it in some instances to 3 feet. Don't go to real large gatherings because you don't know how careful someone else has been. You want to eliminate your contact with those who are sick, and that's all the time. Somebody has a flu or a cold, you want to stay away from them. So with COVID, just keep doing what you should be doing anyway. Getting a good night's sleep, eating a balanced diet, exercise, all very helpful for the mind and the immune system. Doing things to relax. And most important, washing your hands properly and often. Social distancing, wearing a mask when you're out in public, and washing your hands are the best things you can do. Now, people are saying, how do I know what's a good product? What isn't a good product? Fortunately and unfortunately, out in the market and online, there's a lot of reputable companies and there's a lot of bad companies out there that are putting out substandard products. So know who you're buying your products from. There's wonderful health and wellness stores and nutritional centers, and even some of the supermarkets have some good quality supplements. But you want to buy and purchase and select from a place where people can help you choose the right product for you. And I put up some different products just to show you. There's vitamin D. Comes in liquid, capsules, tablets. Vitamin C, you can get in a powder to add to a smoothie or water if you have trouble with capsules, or there's capsules and tablets. Zinc comes all different ways. Quercetin is available in capsules and in powder. In the B complex, a lot of us have methylation issues. So make sure when you get a B complex product, get one that's already methylated, so it's in the form the body can use. Some of the companies put together packages for the immune system. So the one on the left has the vitamin C, the D3, the quercetin, and absorbable zinc. The one in the middle is zinc with quercetin. The one on the right has quercetin, NAC, zinc, vitamin C. So there's all different good quality products out there. So make sure if you're spending the time and the money, make sure you're getting the best product for you. Otherwise, you're really wasting your time and you're not getting the protection that you're trying to get. So now we have 3 different vaccines that are available. And there's a lot of questions about the vaccines and what can you do to minimize the effects of your body responding to the vaccines. Most people with the first shot, they just have a little soreness in the injection site. It's usually, if there's going to be some symptoms, it's after the second injection. And there's a bunch of things you can do to help the body work through these, I don't want to call them side effects, the reactions to the vaccine. One of the most important things is you should be hydrated all the time, but make sure you're hydrated when you're getting the vaccine and for the next few days. Adding a good quality electrolyte mix, a nice clean one that doesn't have dyes and sugar added, can be helpful. There's a product we've been using, excuse me, for years, the Vaccine Support. You take 10 drops, we use this for little kids right through seniors, 10 drops the day you're getting the shot, and then 3 times a day afterwards, as long as you have symptoms. If the symptoms are even stronger, if you're getting the chills and the aches and pains, you can even take it every 3 hours. Gelsemium is a homeopathic remedy, very good for people who the vaccination makes them tired. They can't get their energy back. Homeopathic belladonna, very good for the high fevers and the splitting headache. Some people are getting a bad headache from the vaccine. Arsenicum album in a 15C or a 30C, very good for fever, body chills, you're exhausted, and that gives some people have some GI symptoms with vaccinations, and arsenicum can be helpful. And again, you don't need to memorize all these. You can call us at any time and we can help you. So now I got vaccinated. Is my life right back to normal as soon as I get my second shot? Right now, it looks like the answer is no. It can take you up to 2 weeks to reach full immunity. And we all want to get together with our families, and we want to go on vacation. And grandparents want to hug their kids and grandkids and great-grandkids. And we want to get our lives back to normal. But try not to rush it. When you're vaccinated, it offers you protection after 2 weeks that you 95% it looks like won't get very sick. But we're not sure if you're still able to carry the virus and spread it to non-vaccinated people. So think about yourself and other people. If you're out with non-vaccinated people, wear a mask, wash your hands, keep social distancing, avoid big crowds, because we all have to help each other. It's not, I'm covered, so let everyone else worry about themselves. So really think about it. You want, until we know, are vaccinated people still carrying the virus, just not getting sick? Really think about it, because if we all take a little more time, we'll probably get through this a lot faster. Now, a couple of weeks ago, Dr. Fauci was asked by a 91-year-old woman in Florida. She and her Mahjong buddies are all vaccinated. Can they start getting together and playing Mahjong? And his answer was he doesn't know yet. It'll be just like the treatment for COVID, it's individualized. If these 4 women aren't seeing anyone else that isn't vaccinated, then the people they do see are all vaccinated, then they probably can get together and play Mahjong, being only a few feet apart. But if they're seeing their grandkids or their children who haven't been vaccinated yet, they could be picking up the COVID virus and then spread it to a non-vaccinated person. So we just have to think a little bit longer and harder. If anyone has any questions, feel free. You can email me at gary@naturalcompounder.com. We have 2 functional nutritionists, dietitians, Tamara and Alora, or you can call the Wellness Center at 781-893-3870, extension 3, and we'll be more than happy to answer your questions and help you figure out what's the right protocol for you. If you go to naturalcompounder.com, on our blog site, I have the same presentation, only it's a little more in depth if you want to review it again. And feel free, you can book a consultation with any of us right through the website. And I want to thank you all very much for joining us today. And all of us over at Johnson's would like to extend a special offer for being part of this day today, this wellness fair. When you either order online, by phone, or stop in the store, remember the code COVID-19. That'll get you 15% off any purchase in the store. And the COVID-19 code is valid till the end of the month, till the end of March. So you have another couple weeks. And I'll be stopping the presentation. And I guess if there are questions, we can go to questions and answers.
Thank you so much, Dr. Krakoff. That was really wonderful. I appreciate the individualized approach. That was not something that I had thought about, so that was very eye-opening.
Yeah, and we should be practicing all medicine that way, but we have boxes, and when you come in with a symptom, we figure out A, B, or C, and go with the closest. But COVID, they're finding if they individualize it, they're getting much better results. And hopefully that one of the positives coming out of this is we'll start doing that more often.
Sure. We saw that tile at the end, the last slide that you had there. Would it be all right with you if we added that as one of our swag bag coupons?
Absolutely.
Fantastic. So if you would email just that information to one of our organizers, I will put that in our virtual swag bag, and then everyone will get it.
Okay.
All right. Thank you so much. We really appreciate the presentation.
My pleasure, and have a great rest of the day.
Thank you. You too.
Bye-bye.
Bye. Before we move on to the next presentation, I just want to take a second to remind everybody to go into the booths. If you haven't been doing that already, if you're so enamored of the live stream that you've gotten distracted and you haven't gotten into any of the booths, make sure you go check them out, because most of them have somebody live waiting to talk with you, and all of them have great information. And all of our all of our vendors have worked really hard to put together a fantastic booth for you, including the other directors of the Chambers of Commerce. We have our own booth, and I encourage you to stop in and talk to us. So I want to give a shout out to all the other directors. Beth Locke is the executive director in Arlington. I don't want to miss anybody. One second. All right, Beth. And then Joan Mongeau is the executive director in Malden. In Melrose, they've just had a change, and it's Jennifer. I've forgotten her last name. I apologize for that, but she's the new executive director in Melrose. Megan Day, who has been behind the scenes running most of this show as we put this together, she's the executive director in Stoneham. Melina Richards is the executive director in Waltham. And Dana Garmy is the associate director in Winchester. So I want to thank all of my colleagues so much. They don't all want to be on camera, but that does not mean in any way that they haven't worked as hard as anybody else putting this together. So thank you all, ladies, for making this happen. Great. Okay. And make sure that you're putting questions in the live chat too, because we can absolutely shoot those over to the presenters. All right, so the next presentation we have is Your Financial Health, there we go, with Jeff Wheeler from Edward Jones. And Jeff is also the president of Rotary in Winchester. So thank you very much for being here, and I will turn it over to you.
Good morning. Thank you very much for having us, and I want to welcome everybody and to our 15 or so minutes that we do have. We're going to shift a little bit to your financial health, and what I want to do in a very short period of time is to give you some thoughts and ideas about what you can do presently with somewhat crazy markets that we've all had in the last year or so, and everybody's probably sort of asking, next question is, where are we going, and what do I do, and what decisions should I be making? So let me give you a quick little background. I am located in Winchester. I run the Edward Jones office here, have been for about 3.5 years now, but have actually been in financial services for well over 30 years, and located here a number of years ago. And it's been a wonderful community. I am president of the Winchester Rotary and on the board of the Winchester Chamber of Commerce also. So it's got myself very much involved with the community. But let's talk about financial health. And I want to give you, and the best thing you can do is maybe make sure you got a pen and a pencil to sort of take down some thoughts and notes and how it reflects to you more so than anything else. But let's start. I'm going to give you about 10 thoughts on this. Let's start with the first thing that you've got to do when you're thinking about this is, one, either develop a strategy around your financial wellness, or if you have a strategy, it's time to perhaps review that strategy to make sure that it's solid for you. And within that strategy, you've got a couple of major pieces of that. And it's, one is, what are your long-term goals or short-term goals? Could be education, could be retirement, it could be investment. What's the time frames for those? What's your comfort level of risk? How much risk are you really willing to take in this type of market or over a period of time. And then the best thing you can do is sort of jot those down, have a written strategy so you can go back and just say, you know what, I put this down a year ago or 6 months or 2 years ago. Am I following my own strategy? So development of that strategy is your first piece. Within that, you're going to definitely want to take a look at risk as you get deeper into your strategy and what level are you comfortable. So some of the questions that we might ask, and hopefully working with your financial advisors, you can ask is what level am I comfortable? So if the markets are off 10%, how do I feel? If they're off 25 or 30%, as we saw last year in March and when COVID and the pandemic actually hit, now how do I feel? Do I need to be doing anything? Do I need to be making any decisions? How is it relative to my goals? How much risk can I really take? I mean, I've had clients over the years where when we've had situations, 08, 09, this past year, 2018 in December, we were off almost 20% in a very short period of time. And then, very honestly, Santa Claus showed up, and the next day we went on a tear from then to throughout 2019. So you've got to really make sure that you've got that level of risk sort of established for yourself, and begin to work on that a little bit. The next piece of that puzzle, as you develop and continue to build out your strategy, is talking about really diversification. And it's a word that everybody uses and throws around an awful lot, but it really is focused around asset allocation. And that's something that you do have to understand. And what we mean by that is between stocks and bonds, are you allocated, say, 75% in stocks, 25% in bonds, maybe some in cash? And is that relative to your risk and to your overall strategy and to your overall time frame? And so asset allocation, and there is a stat out there that somewhere right around 92% of your performance will be based around your asset allocation. And depending on whether you're younger and have a longer period of time, or whether you're just a few years away from retirement, where your allocation might be closer to 60-40 or even 50-50. Number 4, stick with quality. You have got to stick with quality at this point. And what I mean by that, whether it's an individual stock and company, whether it's an individual bond, their credit ratings and where they stand from that standpoint of actual credit risk. Those are very important on that side. If you're using mutual funds or ETFs, you want to make sure that you've really done your research on that and the quality, what's in those baskets of mutual funds or ETFs, which is really what they are. And so make sure that you do your research. There's like a lot of great places to go on for research. Yahoo Finance, Fidelity, TD, our own Edward Jones websites too have quite a bit of research on there too. But definitely do your research. Talk to other people, certainly talk to your advisor and get some explanations of that. So stick with quality. Number 5, think about investing for the longer term. Now, each of your goals within your portfolios could be a little different. So planning for college could be 5 or 10 or 15 years off. Retirement could be 20, 25 years off. So there are different goals for different things and different terms of time applied to each one of those. So that's definitely things to think about. Don't make the mistakes of trying to, and everybody hopefully has heard this, of trying to time the market. There isn't really anyone out there individually that really can time the market. You hear a lot of newscaster types or pundits that actually talk about that I called the 08, 09, or I called this or I called that. I will say I had a close friend of mine back in 2007, 2008. He worked for one of the big firms in New York. And we were talking about that in the summer of 2008. The perfect storm was coming. I got to think he actually did call it. And so, but it's very, very difficult. And when you think about that, think about when you go into the market, what is your buying thoughts? What are your selling thoughts? When are you going to buy? When are you going to sell? So when you enter the market too is also important. Number 6, make sure you've got realistic expectations. Don't think that I just go out and I'm going to get 20 or 30% on a position, stock positions, mutual funds every single year. That's not going to happen. Certainly from 2009, 2010 and the last 10 years, the markets have been excellent, and trying to time those last 10 years probably would have been a mistake, because you would have really missed some of the best ups and downs across the board, and really needed to be invested. And there were certainly double-digit returns during that time frame, as in some cases we've seen in the last couple of years, 2019, 2020, which was just a bit of an anomaly, if you will. So realistic expectations are very, very important. Number 7, maintain that balance. You need to take a look at and rebalance yourself during the year, maybe not on a monthly basis, quarterly, okay, but semi-annual or annually to rebalance. What I mean by that is if the markets do move up or move down, your allocation of 75-25, 60-40 may have gone from 60-40 to 75-25, which is outside of your risk level. And you'll need to rebalance that on a regular basis. So my question to you is really, how often do you do that? Now, a lot of programs with firms like our own and others automatically rebalance for you, which is even better. And that way they actually keep you inside of your restrictions and your allocation of what you should actually be. So rebalancing on at least an annual basis is a good thing to do and to look at and to review. Number 8, prepare for the unexpected. Away from sort of the financial a little bit, but the question is, what happens if something happens to you, to someone in your family, just as you're getting ready to retire or sending kids to college? What would happen, and to your plan, to your strategy overall, your financial plan, making sure that you create an emergency fund, and you've got that. And a lot of people have started to change that a little bit. Normally it's 3 to 6 months. Now it's being pushed out a little bit farther because of the pandemic and job loss and things like that, to more around a 6-month time frame. Think about insurance options for yourself. If something were to happen to you, is your family or your spouse or whoever it might be, are they taken care of, and are they protected through life insurance or universal life insurance or whole life or things like that? And then lastly, your estate, wills, health proxies, trusts, depending on your situation. Have you got those set up, or have they been reviewed in the last year or so? Those are things that I work very closely with estate attorneys on to make sure that those are all set up and in place. Number 9 is just focusing on what you control and what you can control. So diversifying your portfolio, quality investments, maintaining a longer perspective, your risk levels. Those are things you can control. The day-to-day fluctuations in the markets, you do not control. You do not control the economy. You do not control the political environment. Those are things that just happen. As we saw last year, towards the end of the year, there was a lot of talk about the market was going to be way off with the new administration being elected. That didn't happen. It went straight up. So there's things that you have to make sure that you do control what you can control, and certainly let the other things sort of flow. And then lastly, number 10, which is the key, is reviewing your strategy on a regular basis. Not weekly, not monthly. You don't need to go crazy on that. But certainly on a quarterly basis, with the markets ups and downs and things like that, you do need to review it on a quarterly basis. Just see how you're doing. Review potentially, depending on if you're working with an advisor, make sure that you set up a situation where every 6 months or quarter or annually, you're at least doing a review on How are we doing performance-wise? Do we need to make some changes? And hopefully your advisor is talking to you about some of those things too. So let me finish that. So we've got basically 10, going very quickly through those. Develop the strategy, understand the risk, diversify, quality, invest for the longer term or whatever the goal is for that, realistic expectations, maintain your balance, reallocation, prepare for the unexpected, control what you can control, and review your strategy on a regular basis. So with that, let me stop there. And if there are certainly any questions, I will be in my booth and around for a while to make sure that actually can answer some questions, or if somebody wants certainly a complimentary review, we obviously do those too. Aaron?
Thank you so much, Jeff. That was really useful information.
Appreciate it.
I don't know if I got all 10 down, but I was taking notes.
You can go
I'll be
ahead.
sure I stop in your booth if I need to and ask more questions.
Absolutely. Absolutely.
Thank you so much.
All right. Appreciate it. Thank you.
So next up, I believe we have I think we are having a nice little core mini workout. So, hey.
Hello.
Those are people.
Hi, how are
you? Good morning.
Good morning. How's it going?
It's going really well. So I'm hoping you guys are going to demonstrate this. I don't know that I'm going to do deep glutes from my chair here. But this is, you're Kyle, right? And
yes, I'm Kyle. Yep.
The owner of Fitness Together in Winchester, right?
Yes, we are Fitness Together in Winchester. The studio's been here for a number of years, but I took over ownership last year, just before the pandemic hit. But real quick on us, we're customized, personalized training. We are very COVID friendly. We currently only have one client at a time. We have 2 different individual bays to keep things separate, so we can sanitize in between clients. Yeah, we have a free consultation, so come to our booth. If you have a minute, we'll be around to chat. Check your swag bag. We do have some free sessions in there for everyone to come check us out. So I'm going to hand it over to Natalie.
Yes.
Again, she's my lead trainer. She's going to take us through a little mini workout for everyone, get some core going, and we'll go from there.
All right. So everybody should step out of their booths for just a minute and do
Just
this with Natalie, right? And get your blood flowing.
Get everyone standing up and moving a little bit.
Yes, let's feel better together. Okay, please have a wall. I think everybody can find a wall. We'll need also a little space on the ground for some core. But let's first start with a little warm up. So I'm gonna go ahead and take off this mask so you guys can actually hear me better. So come ahead, let's stand up. Let's first start with hands out. We're just gonna let that hand come across in the middle. Good, rotating. Just really the upper body first, really keeping the hips nice and straight forward. Good. And inhaling at center, exhaling. Inhale center, and exhale as we twist. Last one on each side. One more. Okay. Hands behind the head. We're gonna have our knee come up, and the opposite elbow is gonna come and join it, just to get a little core warm up here. And rotating. Good. That's 2, 3, sorry. 4, 5, 6, 7. It's the elbow that's coming to meet the knee. One more on the other side. Good. Okay. Going just for little squats. Here. Trying really to shoot the hips back. Try to keep a neutral spine, almost like tucking the tailbone underneath you to reach back. Squeezing at the top, going down. Here we go. Let's do it. 3 more. Very good. Okay, finding your wall. We're gonna have one foot against the wall. You're gonna be in this position, foot against the wall, and all you have to do is just bend the knee and coming back up. You can push into the wall with the heel. The foot that's planting on the ground is the source of the energy to push you up, okay? Pushing through the heel, through the front heel to bring you up. It should really fire your side glute. Also in the back, really breathing through it, inhaling as we go down, and exhaling, coming up, squeezing the glutes at the top. Last 2. Really good. Okay, switching side. Other foot is going against the wall, pushing into the wall with that foot. Now slowly going down and pushing through that front foot. Very good. 3, 4, squeezing at the top. Don't let your rib cage flare up or fall forward. Really try to be nice and neutral, going straight down. Last 2. One more. Very good. Okay, let's step away. Here, slide bend in the knee, that's stepping out. Here, I'll give you another view. My hips are going back. Okay? Don't let your chest fall forward. Really nice and tall. Standing up. Looking ahead of you. Pushing through the heel, that's stepping to push you back to center. Okay? Here we go. 2 more. Inhaling. Here, pushing. Exhaling. Very good. Other side. Nice. I hope all of you are taking this time to just give some love to your body. Get moving. Because as we're spending more time at home, we're spending more time sitting down. More load, that lower back. So really finding this time to take care of that body. Very good. One more. Okay. Shake it out, shake it out. Okay, here. Squats with a little pulse at the bottom. So I'll show you first. Going down, slightly coming up and going back down. All the way up. Coming all the way down, slightly up, back down. Oh yeah, the burn. Squeeze the glutes at the top. Really push into those heels, keeping the knees out, tracking your feet. Very good, guys. Giving you another view. Slide. And squeezing the glutes at the top. All the way up, squeeze. Last 2. Squeeze. For those of you who just joined us, come and do some squats with us. Up. Last one. Very good. Okay. Now, leaning forward. Here, I want you guys to slowly bend the knees to find yourself in this position if possible. If this is not possible, hang here for a little, okay? Just slowly down. Good. To finally sit on your butt. For those of you who couldn't do that, just go ahead, give a little bend in the knees, find your way laying on the ground. Here, we're gonna do some hip bridges. So feet should be quite close to your hips, okay? Try to touch your heels with your hands. You'll know you got your feet at the right position, okay? Now knees always pointing out, okay? Don't let them drop in as so, always out, okay? Here we go. So, pushing through the heels, lifting the glute, tucking the tailbone underneath you, squeezing those glutes as hard as you can. Push those knees out, push through the heels. And here, we're gonna go down, tap, don't rest on the ground, and finding that same contraction by really bringing the tailbone towards the ceiling, squeezing the glutes, and down. Here, 5, holding, 4, 3, 2, 1, and down. Coming back up. 5, 4, squeeze the glutes, don't let that tension go. Last one. Holding, 5, 4, 3, 2, 1. Don't bring the hips down, bring the feet together. Just so you were out here, bring them here together. Hips are gonna stay at the same level. It's just the knees that are gonna go out. Okay? I hope you guys can see this. Squeeze the glutes as your knees are pointing out, okay? Big squeeze. 3, 4. Keep those hips nice and high. Don't let them drop. People would have the tendency to just kind of let them drop as you open the legs. Really keep them nice and high, those hips. Good. Feeling the burn? Means we're doing something right. Come on. Really feeling it in the glutes. Try not to let the hamstrings take over. Sorry, the quads take over. 2 more. Very good. Nice. Okay. Now that we are on the ground, we're gonna go on the side. On our side, sorry. Knees are gonna be bent 90 degrees right here, okay? My hips are slightly back. I'm gonna meet my elbow with, I'm gonna put my elbow at the same level as my knees, okay? To be able to bring my hips up, and so I am in a straight line from knees to shoulder, to give you another perspective right here, okay? Hand is gonna go up to the ceiling, slightly dipping the hips down to come up, and rotate under, hip slightly going down, almost trying to touch the ground, and the hand coming under the armpit to open up and hip down. Squeezing the glutes together. Don't let that tension go. Shakiness is good. Open, dip down, rotate under. 1 more. Switch side. Okay, here we go. Knees and elbow aligned. Hips are gonna come in, hand to the ceiling. Hip is going down, hand under, and open. Here we go. Speeding it up. Looking back as your hand is going underneath you. Last 2. Very good. And here we are. All done. You guys did it. That was 15 minutes.
Nice job. Geez, thank you. I have to say, it always makes me feel better when a trainer is panting at the end of something, because
Yeah,
You
absolutely.
know, obviously, she's in excellent shape, and it's still difficult. So
Still tough. Yep.
awesome,
Doesn't take any weight.
Natalie. Thank you. Thank you so much.
Yes, thank
Those
you
are
for
great exercises.
allowing us to come on here. And yeah, again, come by our booth. We'd love to chat.
Check your bag.
Absolutely. All right. Thanks a lot, guys.
Thanks so much. Take care.
Bye-bye.
So next up, we have Dave Tasto, who's the owner of Assisting Hands, which is a home health care agency, and he is the owner of the Greater Boston Northwest territory for Assisting Hands, right, Dave?
Thank you, Erin. I appreciate it. Thanks for the opportunity.
Yeah. So
All
we
right.
have, Dave and I have talked, well, Dave and I know each other for the last several years, but because
Mhm.
he's on the executive committee for the Bedford Chamber of Commerce, and he's also a member of the Lexington Chamber of Commerce.
Thank you. Yeah.
So thank you for that. And of course, a major sponsor of today's fair. So thank you very much for that, because that's really key in helping us get this off the ground. But I was going to mention that you and I spoke as part of my Lexington Learns series, which is on YouTube. And if you look for the Lexington Chamber of Commerce on YouTube, you'll find our channel, and all of the Lexington Learns are there. And Dave and I had a conversation about this book that you've written.
Yes.
Congratulations on that. And it's called Thriving at Home. So I'm going to turn it over to you and let you talk about what that involves.
All right. Let me just share my screen here. And there we go. Application window. All right. There we go. So good morning. Happy first day of spring. Again, I'm Dave Tasto, owner at Assisting Hands Home Care. We're based out of Bedford. Thank you so much for joining the health fair today. We are proud to sponsor this event, bringing health and wellness resources right to you in the comfort of your own home. So a summary of today's presentation. Nearly all of us want to continue thriving at home or living our retirement years where we want to live. I'll share what items you need to address in your plan to age in place, and specific things you can do to keep your home safer, how to manage aspects of your health at home, and how to prepare for hospital trips. I'll start with a little bit about me and how I was inspired by caregivers helping my grandmother. And we'll finish on how you can get extra help at home, and also leave time for some questions at the end. All right, so getting started here. So a little bit about me. As Erin just mentioned, I recently published a book called Thriving at Home, a handbook for preventing hospital stays, and I'll cover more about that shortly. I am the owner of Assisting Hands Home Care. As I mentioned, we're based out of Bedford, Mass, and we cover many of the towns north and west of Boston. A little background on me. I grew up in Minnesota, moved out to Boston for college, graduated in engineering, and I worked for a couple decades across various industries. My entry into healthcare, and specifically home care, was a personal experience. And that takes me to my next slide. About 5 years ago, my grandmother was diagnosed with dementia, and she moved in with my mom and stepdad, who were her primary caregivers. As the disease progressed, though, it became harder and harder for my mom and stepdad to care for my grandmother. So she moved into a community and in the memory area of the community. Towards the end, she did require some support from hospice, but with the hospice benefit, she was able to get extra support from aides or caregivers. These caregivers quite impressed my mom, so much so that she would call me from Minnesota and share all the wonderful things that these caregivers did. Just getting her up and ready for the day, showering, basically getting her dressed up and ready to go and ready for breakfast. I was back in the Boston area working in engineering and product development, but I was piqued interest about starting a business and wanted to know more about this caregiving and what these caregivers were doing. My mom actually even mentioned to me at one point, if she had known that help like this existed, she could have kept her mom at home longer. What kind of inspired me, though, my story here is that I actually had a chance to meet those caregivers that were caring for my grandmother in that critical period. I went back out to Minnesota, and was able to meet them at my grandmother's funeral. Not did they care so much just to attend her funeral, having only worked with her for a few weeks, but these caregivers shared stories on how they were able to keep my grandmother smiling. As you can see in this photo here, she has a big grin. But they did curl up her hair. You know, you can see she's got curly hair, and even did her nails. You can see at the bottom of this picture, she has hot pink fingernail polish. But this is, you know, and this is a photo is of one when I went and visited her once back in Minnesota at that community. Just amazing place. But what really touched me as well is one of the aides also had a grandmother who was going through a very similar situation. And she traded stories about how she would share blouses between her grandmother and my grandmother. And my grandmother got to be wearing her favorite new blouse and smiling. These caregivers didn't have to do all of this extra work. They didn't have to go that extra mile, but that's just the type of people they were. They just truly cared inside their hearts for that person inside my grandmother's body. You know, she was somebody's mom, somebody's grandmother, and even to my kids in this picture, somebody's Gigi or great grandmother, as they called her. But at Assisting Hands, when I came back from Minnesota, I found Assisting Hands, looked into various businesses, but I settled with Assisting Hands because of the focus on high quality care. At Assisting Hands, we believe that everybody deserves the same kind of care that my grandmother received, and that guides our everyday. There's a little bit about my story. Just reminds me of my grandmother, and it's just touching for me. The objective today, though, here is to share some practical advice for you on how you can keep you or your loved ones thriving at home or out of the hospital. Why did I write the book Thriving at Home, or about preventing hospital stays? Well, many of us have the goal to age in place or live our retirement years where we want to live. And this could be move in with family, as my grandmother did, or it could be into an independent living community or assisted living. In home care, I have seen firsthand how individuals can age in place, but maintaining your health at home is key to staying out of the hospital or rehab. Hospital stays can be very difficult, expensive, and actually cause unintended consequences. There can be complications, infections, and so forth. The other thing is that in home care, I saw even last spring and summer that family caregivers had been shouldering a lot of the effort in caring for their loved ones. And then, and even these days, we're seeing a lot of it. But many of those folks don't have formal training, just like my mom and stepdad, but they're juggling work, household, chores, and possibly even care for children. At Assisting Hands, our care team does a lot to keep individuals healthy. And all these things that they're doing, though, are non-medical interventions that can be done by family caregivers. So I decided to write the book to share that knowledge in providing tools and techniques or interventions that family caregivers can use so that they likely have better outcomes for their family members and hopefully lead to a lot more happiness as well. I also wanted to promote just awareness about care options, including the type of support at home, so that more folks are aware, as my mom wasn't aware of the resources that were available for her. So getting support at home, though, is part of a comprehensive aging in place plan. Don't necessarily worry about the slide here, or sorry, the worksheet. I can provide a copy of the worksheet for you. But basically, all plans for aging in place should start with your goals and objectives and cover each of these areas: health and wellness, the resident's style of living, your financial needs, and so forth. On the health and wellness, for example, maybe your objective is to stay fit and mobile into your 90s. Or you could capture certain wishes, how decisions are going to be made, like a healthcare proxy, certain items that are legal, or other financial needs that Jeff was just talking about. As part of the developing the plan for each of these elements, the particular considerations that are going to need to be addressed will be outlined, and then you'll have to assess which items of those considerations you can manage on your own, and then which items are areas that you're going to need help with. If we go to an example, let's just choose residence or style of living. For housing, it could be, where do you want to reside in your retirement years? As I mentioned earlier about living at home as long as possible, move to a community, live with a family member. If you move to a community, for example, you'll have to be, one of the considerations may need to be that you have to sell a home. Or if your plan is to stay at home, maybe you want to budget for an extra support at home. Also at home, maybe you want, as you age and get into your 90s, after your 90s, maybe the mobility is a little bit lower in your retirement years than it was earlier. And so you might want to have a bedroom or a bathroom on the first floor. So there could be some home modifications. I don't want to make this too complicated. There's a spreadsheet or a worksheet here that can help support this planning. But I want to make a note, though, the aging in place plan should also, and make sure that it considers yourself, but also your spouse. If you're a caregiver and something happens to you, what plans need to be in place for both of you? It's a key thing that we have to cover these days. Often the caregiver might have a fall and they're caring full time for their loved one. These are types of things that we can help work with and put contingency plans in place to help you, stay your retirement years where you want to continue thriving at home. In keeping yourself at home or your loved ones at home, a big piece about doing that and being able to stay at home is really making sure that your home is safe. The number one reason why older adults go to the hospital is because of falls. The good news is, though, that many falls are preventable. A few key points, and more of this is captured in my book, Thriving at Home, but we want to make sure that there is proper lighting in the home. Having appropriate levels of light will allow loved ones to see hazards. Once there are, we identify the hazards, we need to make sure we pay close attention to those hazards, and these could be rugs or transitions between rooms. Uneven floor transitions could cause trip hazards. So we want to address those. It could be modifications or just moving some of the rugs out of the way. Additionally, you can see in the graphic here on the left, in the bathroom, there are some grab bars, rails, on both sides of stairs is another big thing in the bottom right there, making sure that you might have a stronger arm, stronger leg, or just need balance when you're going up or down the stairs. So having rails on both sides of the stairs is a good thing. But maintaining your strength and balance is also critical to having, basically safety in your home, because a trip and fall is often the result of losing your balance or not having the strength to do certain things that you might have had previously. So exercise is very critical for staying strong, and it's going to help reduce the risk of falling. Again, there's additional tips in chapter 1 of the book, which is the start of making sure that you're going to thrive at home. As I mentioned, managing aspects of your health at home is critical to aging in place, if that's your objective. The top chronic conditions that are causes for going to the hospital are on the slide here: diabetes, heart failure, chronic obstructive pulmonary disease, and stroke history are often top drivers to going back to the hospital. And I'll share a little bit of a data point here. 1 in 5 Medicare patients go back to the hospital within 30 days of leaving the hospital. So 20% of folks don't just go home, but they go back to the hospital within 30 days. So there's a lot of stuff that families can do to prevent those trips back to the hospital. That starts with managing your health at home, starts with knowing which symptoms are common for your situation, your condition, staying in touch with your healthcare provider, keeping notes about how things are going, your symptoms, or diet and exercise. But the key thing is, I mentioned, to stay in touch with your healthcare provider. If knowing when to escalate is a key piece as well. So should you have abnormal symptoms or pain, that's when you need to reach out before it turns into a crisis. There's a whole appendix full of information in the book about what you can do, things to monitor, watch out for those critical chronic conditions. So hospital trips, they can be needed and should not be thought of as a last resort. Okay, this presentation here is not meant to disparage hospitals because they can often be the best source of care. But as I mentioned earlier, they can be a challenge for folks going to hospital, particularly with neurological conditions like Alzheimer's, in dementia or Parkinson's, where medications are adjusted. So planning for a trip to the hospital is critical. A trip to the ER or even just the hospital. But you often don't know when you're going to have a trip to the hospital. So planning, putting a package in place is critical. You know, having your emergency contact information, some documentation, like a medication list, who your healthcare providers are, healthcare proxy, some insurance information. But a big, another important piece is to make sure that you have leisure and communication items with you, so that you don't know how long the stay might be in the hospital. So bringing your phone, computers, or and remember to bring chargers so that you're able to stay in touch with your loved ones while you're in the hospital. These days, it's a little bit challenging in that you can't often have visitors sometimes in hospitals. So making sure that you're able to stay in touch is very important. Leaving the hospital is probably the most critical time to be on top of everything. Okay, and there's a lot of stuff to be aware of. In the book, there's 23 questions to ask. But these questions, having answers to these questions is likely going to help reduce your chance or your loved one's chance of going back into the hospital. There's really 4, and these are questions here. I won't read all the questions, but you can get them in the book. There's 4 key areas that you want to stay on top of when you are leaving or after you've left the hospital. The first, we'll talk about like non-compliance, which is just another word for not following instructions. It is one of the most common reasons for return trips to the hospital. So all the discharge planners and hospitals do a great job at providing a lot of good information, follow-ups that you're going to need to have. All of this information is provided when you leave the hospital. Getting help if you're not able to follow all those instructions is critical. Having someone to watch out when the medications are needed, picking up all the prescriptions and so forth is critical to keep you off of the track of going back into a hospital. Additionally, understand your medical conditions and actions you can take, who to call, when to escalate and so forth are critical. I mentioned the follow-up appointments. Attend those prepared. Bring a notepad, bring a list of questions for your primary care. They are often very quick visits, so you have to go prepared. If you do need someone, bring someone with you who can help take notes or remember exactly the instructions leaving your primary care. If you do need extra help at home, if you do need extra help at home though, here's some tips or questions to ask about what to look for in selecting an agency or someone to help out at home. And again, there's 10 specific questions to ask in our book, Thriving at Home. I'll just touch on a few of them here, but basically, having a team in place before you hit an emergency is critical. So reach out and develop relationships. It could be a visiting nurse company or a other legal or financial. So have items and plans in place before you run into a crisis. And this can be all part of the Aging in Place plan. Our Thriving at Home approach really focuses on 3 key elements. There's a little bit more information in a video in our virtual booth that you can attend as well. But it focuses on 3 key areas, ensuring smooth transition to and from hospital. So documenting and minding all those details is critical. Maintaining your independence. As I said, having your strength and balance into your retirement years is critical. So making sure that you're staying fit and you're doing exercises is critical. We only support as needed, only where tasks are needed, and we encourage independence. Carefully managing matching each of our clients with a qualified and trained caregiver, someone who you can trust is key to our Thriving at Home approach, so that a bond starts on day 1 and you're looking forward to that person coming in to help out. Communication is the last thing I'll touch on here. It is so critical. We all want to be informed. Our caregivers at Assisting Hands put their care notes directly into their smartphones. So all of those notes then can be immediately available to family members, or with family authorization to other care providers in the care continuum, so that all of the details are minded, and we can spot an escalation as soon as we can before it turns into a crisis or a return trip to the hospital. I'll finish up here by just providing a little bit of contact information and leave a little time for some question and answer. But I would like to highlight a free gift from Assisting Hands to all of the health fair attendees today. We're willing to provide 4 free hours of in-home support and a complimentary copy of my book, Thriving at Home, a handbook for preventing hospital stays. That wraps up my presentation. I can open it up for questions. Erin, if you'd like to ask any questions, I'm here to answer.
Thanks, Dave. This is such great information, and it's so relevant to so many people. I think, well, we all know the population is aging, and most of us will encounter this at some point, whether it's parents or aunts and uncles, siblings, spouses eventually, and so forth. So I think everyone can benefit from this information, no matter what stage of life they're currently in.
Thank you. Yeah.
So it's very generous of you to offer a free copy of the book. We definitely had people asking, though, where you can buy the book. So where can you buy the book if you, say, wanted to refer a friend?
Sure, no problem. You can go to thrivingathomehealth.com. It's also available on Amazon as well and other bookstores.
Fantastic. Okay.
And you can ask your library. It should be available. You can ask libraries to get a copy of it. It should be available through other channels as well.
Oh, wonderful. Excellent. Okay, so you've made it very widely available, which is very helpful.
Mm-hmm.
We'll make sure we put that URL in the live chat so people know how to click on that.
Yep.
So one question I had while I was listening to your presentation, I had not heard about your grandmother before. I didn't know that was how you had gotten into this field. And it's a very lovely story. So thank you for sharing that. But it made me think, I'm in a situation a lot like that my parents are living in Texas and they're getting into they're nearing 80. And how do you manage this if you are at a distance, like a great distance, Minnesota versus Massachusetts or Texas versus Massachusetts? How do you manage that process for loved ones who are so far away?
No, that's a good question. We run into it a lot, and obviously we're providing support for folks that are living in this area, but often we have out-of-town family members, the sons, daughters, or relatives that are looking to get support in this area. There are resources in other parts of the country that can connect you. Reach out to folks you trust, though, family or friends in that local area. As a national franchise, we do have offices and support in other locations within the country. But types of resources, care managers are great resources to connect in with and can be the local quarterback in providing support for your loved one. But build relationships with firms like care managers or home care providers before it's needed, before that crisis happens. Reach out, build connections, establish relationships. Don't have to start care even, but have those relationships before it's needed.
That's really helpful. Thank you. The last time you and I talked, it was it was right as your book was being published. Mm-hmm. So what's the reaction been? What kinds of feedback have you been getting from people as they've been able to read through it?
It's been very positive. It's a great resource. Folks are saying that they're referring back to it, providing it to friends. We have some partners in the home care or healthcare industry that are providing it to their clients and families. So partners of Assisting Hands are distributing it to families as gifts to help keep their loved ones at home.
Oh, that's lovely. How do you know when it's time to stop trying to manage things at home?
There's warning signs that I have, and I've provided in another presentation. Warning signs, basically you have to focus as the caregiver, you have to focus on self-care first, right? Mm-hmm. You have to take care of yourself. The analogy is just like in the airplanes, put your oxygen mask on first so that you're able to continue caring for your partner. But the warning signs really deal with burnout or exhaustion, not getting sleep on the care partner's side. So if your ability to provide or continue providing care starts getting affected, that's when you need to reach out,
That's very
because
interesting.
then it could be, tough situations for both the loved one and the care partner.
Yeah, and that's not an intuitive answer, because you wouldn't think that the warning signs are on the part of the caregiver. You'd think the warning signs are on the part of the person needing care.
Right.
That's really helpful. Thank you.
Mhm.
We have, as Chambers of Commerce, I know several of us have been engaged in conversations about dementia-friendly spaces out in the world. So, restaurants, and how retail establishments can be more flexible and more attuned to the needs of people with dementia and other cognitive interferences.
Mhm.
What can you add about that?
Thank you. Even for Lexington, I'm presenting on May 20th for the Lexington Goes Purple. So many towns have activities, to highlight these types of, dementia-friendly initiatives. And I'm kicking off the month-long series of activities at the presentation, called, Thriving at Home, Caring for Loved Ones with Dementia. And, providing resources, tips, and information to family caregivers so that they're able to help prepare themselves, or help, manage the health of their loved one. But a lot of towns are kicking off many initiatives to really highlight what's going on in these communities.
And just so that we're clear, purple is Alzheimer's awareness, right?
Yeah, the Alzheimer's Association, thanks for bringing that up. The Alzheimer's Association has an initiative to really talk about it, and their logo and this messaging is all based around going purple. Yep.
Yeah. Excellent. What are some of the things that people forget to think about? Most commonly say, I know you have worksheets and all of that, but what would you say is kind of the most overlooked piece of it?
We run into things that are overlooked in different areas all the time, but I think I'd like to highlight just the resistance to starting up care. It's a question we get all the time. It's not necessarily overlooked, but family members are concerned because their loved one just doesn't want the care. They don't want to start up care because they don't feel like they need it or be a burden on the rest of the family. But if they start from the perspective, and we can share this in working with the family members, basically, the support is really to help the child or spouse than it is to help the person. As I talked earlier about the burnout and the caregiver exhaustion, giving that caregiver a break is often how support is started up in homes. So not to lose sight or overlook, basically overcoming that resistance is a big piece of it. But how we do that, though, is we start with a task or two, just building a relationship with the caregiver. This often the care evolves into personal care, which is tough to accept, not having someone from outside the family or close relatives. So starting with a task or two and slowly building that relationship is very critical to getting care started or getting some outside support.
Okay. Excellent. Thank you so much. You're going to be in your booth for a while?
Yeah, and I have a teammate as well in the booth as well. Yep.
Okay. Excellent. Thank you so much. And again, we couldn't be more grateful that Assisting Hands, that you helped sponsor this fair in such a major way, because I think that this has been already, we're seeing lots of positive comments in the chat and so forth, and about, this whole experience. So I think people are getting a lot of great information, and I really want to thank you again for helping make that possible.
Well, thank you again, Erin, and Megan, and all the other chamber directors. This is, the first of something you haven't tried before. I'm happy to be part of Cutting Edge Ideas, and what a successful way to bring resources to folks in homes. So I see this as the future. I think there's going to be one of these every year, possibly. I don't know that we're going to need to go to a local health fair in person when we have these resources like this available. Thank you so much.
Absolutely. No, we're having fun with it, and it's definitely experimental, but I think we all agree too. We'd like to use platforms like this to connect, in a lot of different ways.
Thank you. Have a wonderful day. Happy first day of spring, everybody.
Thanks. Yes. Happy first day of spring. Thanks, Dave. All right. So, and actually, before we move to the next one, I do want to say just for a second, I know I acknowledged my colleagues earlier, but this collaboration, this fair is a collaboration between 6 different chambers of commerce. And I want to emphasize how well we've all been working together. Chambers of commerce, you sometimes get siloed and, I'm helping my town. And the group that we have here is a fantastic group of leaders who have worked tirelessly over the last several weeks to bring this together. We have split up the work, we have supported each other, and it's kind of it's a novel experience. So I want to thank again my colleagues for putting this together, because it's taken quite a bit of work to get it all here, but I think the resources are just outstanding for everyone. So, all right, next up is Dr. Grayson Connors. He is with Excel Orthopedic Specialists. He's an attending surgeon at Winchester Hospital, and he's going to tell us about same-day hip replacement surgery. This is fascinating. We've actually already, just the title of your talk, Dr. Connors has made people say, what? Same-day hip replacement? I want to hear about that. So I'm going to turn it over to you, and let's hear about it.
Wonderful. Thank you very much. I appreciate you guys having me here today. I'm happy to share some wisdom on this topic. So it's a bit scary, I understand. Is my screen shared? I have a PowerPoint prepared. Okay, so let's go ahead and load that up. Can everyone see that? Okay, so some of you guys can see my screen. So we'll go ahead and talk about same-day hip replacement. So it's been around for quite some time. It's been around for a few years at this point, where patients have opted to go home versus stay in the hospital. Many years ago, it was be admitted to the hospital for a week before the surgery to get cleared, and then stay in the hospital for a few weeks while you kind of recovered from the surgery, and sort of also got optimized at the same time after you had your surgery. So we have it kind of down to a science where all the optimization for the surgery and clearance happens beforehand. So really, you come in, you get your hip done, and you can go home the same day if you like, and if you're safe to do so. So I have an overview here. This is just sort of what we're going to talk about. And then at the very end, we'll go over a little bit of new technology that I'm really excited about, that Winchester has access to. So it's pretty groundbreaking information. And we'll go ahead and get started. So is it safe? Yes. So thousands of patients over the years have opted for outpatient hip replacements or even the hospital same-day discharge. It all starts with medical clearance. That's the most important factor. Some patients are not candidates for various medical conditions and overall health, but thousands of patients we've seen over the years are candidates for it. We also start with a questionnaire in the office to look at your overall health and your support at home. If you have 100 stairs to get into your house, perhaps it's not the best idea. So we go through all of that with you to make sure that you can put yourself at ease. But importantly, a motivated patient is kind of starts with that. Patients really have to want to do it. This is something that we don't push on anyone. Patients say to us, I'd rather be home. In the pandemic, we've had a lot of patients opt for going home the same day, and whether or not they go to the surgery center or whether or not they go to the hospital and go home the same day, they get excellent care. And a lot of times it starts with the patient asking this. So we always want to make sure that it's a decision that you want to make, nothing that we kind of tell you that you have to go home. So we have noticed that with the pandemic, a lot of other surgeons who did not have experience in going home with their patients going home the same day have transitioned towards going that route because of the pandemic. A lot of patients wanted to be out of the hospital when it was in the peak numbers. So we've seen a transition towards this just in general in the last year or so, even with doctors and patients who may not have already done that in the past. And then, of course, you need a highly trained medical team with experience doing this. So that's very important. So how do we do it? Well, it starts with pain control, right? So we want to make sure that you're not feeling like, the pain is out of control on the day of surgery. even though you most likely have been dealing with a lot of pain for quite some time going into the surgery, we still want to make you as comfortable as possible on the day of surgery. So that starts with smaller incisions. So we call that minimally invasive surgery. Careful handling of soft tissue. So an incision is only the very top of what you see, but how the surgery is done underneath is very important with the dissection and careful tissue planes. Minimizing narcotics. So by giving a multimodal pain regimen consisting of anti-inflammatories, Tylenol, which also includes nerve blocks and local anesthesia during the surgery. All of this combined helps you have less narcotics during the surgery and after the surgery. We have some patients, quite a few, who get no narcotics at all and during the day of surgery. So it's quite remarkable how we can get that going for some patients. We also do spinal anesthesia. So spinal versus general anesthesia. We get some questions about whether or not patients would be a good candidate for one or the other, and if one is better or one's worse. Well, every patient is different, but we tend to prefer spinal anesthesia. So patients are still asleep, but they're breathing on their own, and we find that it's a little bit less of a groggy day for the patient when they undergo spinal anesthesia. So they're not really coming back from some of the medications they had to get to put them to sleep to be breathing artificially. So we find that the spinal anesthesia does kind of allow patients to wake up feeling more refreshed from a nap, and their legs are numb and they're paralyzed for just a short period of time during the surgery, and then all of that comes back afterwards. So we try to avoid general anesthesia when possible, specifically for patients that are requesting to go home the same day. However, general anesthesia has many of its benefits and is quite good for some patients as well. So, and we rarely ever hear of patients complain of day of surgery pain that's unbearable. Most patients will tell us that their surgical pain on the day of surgery is from between a 0 and a 4 most of the time. So it really is well controlled, and we have it dialed in for a large percentage of patients. One thing to mention, now that Winchester Hospital, now that I'm at Winchester Hospital, I've brought the direct anterior approach there, as well as to some of the surgery centers that I also frequent to. I find that this has been very helpful in my hands in minimizing postoperative pain and allowing some early recovery. There are many ways to get to the hip, many ways, and they all have their benefits. And depending on the surgeon that you see, you want to, talk with them to the approach that they're most comfortable with, because that's the most important thing. But we have seen that direct anterior approach can allow us to use smaller incisions using a specialized OR bed that allows us to move the patient's leg around the table, so we can use the smaller incision and less dissection and less, soft tissue handling during the surgery, and without cutting any muscle and just kind of going in an intramuscular plane. We find that really does help with postoperative pain, and patients can find they can get back to functioning quite early after the surgery using that. We take an X-ray in the operating room. We find that doing so really helps us prevent outliers. It really helps the precision on the surgery, and we can and we offer to patients a CT-based templating software, as well as patient-specific planning and navigation using something called the Hip Expert, which is something that we brought from the Baptist Hospital over to Winchester and the surgery center. So it's some of the newest technology, but it has been around for a few years. But there are some newer versions of the software using augmented reality, which I'll just briefly touch on at the end of this conversation, just to show you some exciting stuff that it literally is the most advanced hip replacement technology currently to date, which is available in our community. So what can you expect on the day of surgery? Well, just to ease some of your concerns, perhaps you might have spoken to people that have already had this or not, but I'll just kind of let you know how it works before you get to the surgery, during the surgery, and then afterwards, and then the few weeks afterwards, just to kind of make you feel a little more at ease. You get there a few hours before. You see the nurses in the preoperative area and get ready for the surgery and answer any questions you have. Once you get closer to your surgical time, our team of OR nurses and anesthesia doctors will introduce themselves and get to know you. The surgeon's then going to see you and discuss any questions or concerns you have, and then he's going to mark your leg. You're going to go back to your OR for the operation, and you have a short nap. In a few hours, you'll have a brand new hip. Your surgeon's going to call your family member and let them know how everything went and what to expect over the next few hours, the next few days. And then once you get back into the postoperative recovery unit after your surgery, you'll see some of the same nurses that saw you beforehand. Most patients within an hour or so feel comfortable. They have a light snack, some clear liquids, and we get a postoperative X-ray as well in the recovery unit. If you had a spinal anesthesia, typically within a few hours, your leg sensation and muscle strength starts to return, and it'll be time for you to start walking. You have highly trained nurses in the postoperative area and the physical therapist that will get you sitting up in bed, and they'll check your vitals to make sure you're safe to kind of start moving. And then, believe it or not, with a walker or crutches, you're going to start walking down that hallway on the same day of your surgery. So quite different than 20 years ago or so. So it's going to be strange at first, but you can feel confident that you can trust your new hip when you take your first steps. You'll be surprised at how well you move on your new hip. It really can feel like your unreplaced hip, just even a few hours after the surgery. And quite often, a lot of patients will feel like that gnawing pain they had before goes away, even the day of surgery. So, and then eventually, after resting a few times, you're starting to go up a few flight of stairs, and they're going to return to your bed. And once you've passed all of our safety requirements for moving and taking care of yourself and showing us kind of how you can do a little of your ADLs, and you feel fully recovered, the nurses will transition you to getting dressed in the clothes you came this morning. And then in a short time, we'll call your family and let them know that you're ready for home. Once you get home, the day afterwards, you're going to be seen by some nurses and physical therapists to assess your overall health, check your wound, see how you're doing, check your vitals, and just get you moving safely for the next 2 weeks. The third week after your surgery, you start to go to outpatient physical therapy. Most often, patients start to drive around that time once you're off narcotics and once your physical therapy has cleared you. So every week you make progress. Your surgeon checks up on you directly or through discussions with your nurses and the physical therapist just to make sure you're progressing. At 6 weeks, you're going to see us in the office, and you should be feeling pretty well on your way and get back to all your activities you've been missing out on. So it's quite an eventful 6 weeks, but you really feel that you make a lot of your recovery in that first 6 weeks. So and that starts with either going home on the same day or even the next day, or really whatever winds up being safe for you. So we just want to let you know that a lot of patients are candidates, but not everyone is. So it's just something to consider if you're thinking about hip replacement. And just in a few minutes, I wanted to go over just some new technology that I'm excited about that we have available to us at Winchester Hospital and the surgery centers. What's been around for quite some time is HipExpert, which is a personalized CT-based planning and preoperative templating software that allows us to use an intraoperative patient-specific navigation device based on all of the software that we used before the surgery. So it's a navigated hip that winds up being patient-specific. And it works with various manufacturers, various types of implants. And now that company has given me some slides to kind of show you a little bit of their technology. And what's new this year in 2021 is the Hip Insight, which is an augmented reality hip replacement. So, and that was only a few weeks ago that we did that. And I was fortunate enough to participate in the first ever augmented reality hip replacement. So, and I was done at a surgery center. So we'll go ahead and just go over some of that. So just a lot of information with this, a lot of cool software kind of planning devices that I'll show you in pictures. But this is the HipExpert. This is one of the software pictures that we can do before the surgery, during the surgery. We have an application that we can put on the computer. It gives us lots and lots of information down to the micromillimeters to kind of plan the surgery and look for different changes in limb length and alignment. And then we have a device that we can put on you during the surgery itself that can align us and target kind of to where we feel based on your CAT scan the perfect position of your components should be, as well as the size of those components. So it starts with the CT scan as well as functional x-rays. We look at how you sit and how you stand from a side view to see how your spine talks to your hip, to see the relationship between those two parts of your body, because we find quite often that a stiff spine can make the hip work harder and vice versa. And then we use a cloud-based planning system that gives us a detailed preoperative plan that we can use during your surgery on a touchscreen or on a laptop or a device during the surgery that we can actually change while we're doing the surgery. So, and it tells us all the information that we need, which allows us precision during the surgery, a little more than what we're used to, and it allows us to decrease outliers. So this is an example of some of the information that your surgeon can look at if he chooses to use the HipExpert. And then we just can do all the different manufacturers with this. So it supports lots of different implant systems. And then we put an alignment tool on you during the surgery, and it correlates with the software targeting device. You can dock onto the patient quite simply. We can just place it on you and get a good purchase. And using the anterior approach, this is just a little video that kind of, if you can see this, shows docking the device during the surgery. Using the tool that we place on you and docks to your body, which correlates to your CAT scan measurements and our program. And we can basically dial in exactly where we feel the best position of your components should be using the CAT scan software. And you can see here the surgeon is angling the device with the targeter to make it look in both planes exactly like his planned position should be. So it's quite quick to use. It usually only takes a couple minutes to use it during the surgery, and then the component is in, and then you can move on to the next step of the surgery. So it's quite fascinating technology, and it really is. It's efficient to use, it's accurate, and we've done over 10,000 surgeries around the world using this technology. So, and some of the data on this device, the hip experts showed that using the anterior approach, some of my fellow colleagues over at the Baptist found that there were no dislocations or revisions done in 12 months post-operatively. So, and no outliers. Their components more than they planned. So, this is just some exciting technology that we feel is really worthwhile when considering a hip replacement. And I'm very thankful that they shared some of those slides with me to use to kind of show you some of the things we can do at Winchester Hospital. Even going one step further is an augmented hip replacement where we can actually do a holographic lens during the surgery where we place it on you and we can actually see a three-dimensional image that changes with your positioning during the surgery. So as a lot of you may know, we do a lot of hip replacements during the year. We're predicted that in the next 10 years that it's a 70% growth. We feel that there's a lot more patients that will be needing hip replacements going forward. So the most technology and the most precision is important to prevent outliers and to prevent revision surgery. So the goal of the surgery is obviously to minimize the complications and to give the best outcomes as possible and give the surgeons the most precise way to do it. So this is myself as well as some other surgeons from the Baptist doing the first ever augmented hip replacement. So and it went fantastic. And these are just some images of anchoring the device to the patient. And you can see on this picture here that this is from my eyes looking through my holographic lens and seeing a targeting device that's positioned and seeing the patient's bony pelvis in space based on a side positioning of their body. So it really is quite fascinating. And you can even see a little video just showing our hands using the holographic lens moving the positioning. So we can target exactly where the components go using the holographic lens. It really is unbelievable, and it is the most cutting edge technology that we can offer using that same hip expert type of technology. So, and it received FDA clearance this year in January. So it is the first ever augmented reality hip replacement surgery. So pretty cool stuff. And it kind of is a little bit different than traditional navigation systems where the surgeon takes their eyes off the patient and kind of looks ahead and has to kind of watch the machine and using the robot. So it's nice that you can be looking at the patient directly and kind of put the feel in the surgeon's hand. So, and it can be used at all different health systems and all around the world. So it really is some cool stuff that I thought I should share as well, along with the same day surgery and all of that stuff. With keeping the minimally invasive concept in mind for same day surgeries as well as precision allows us to give you guys the best results. So I think I think we have plenty of time for questions. Please let me know how I can answer anything and whatnot. So I'm happy to help.
Thank you, Dr. Connors. That was really fascinating. I had no idea. I mean, to me, it looks like we're in the range of like a sci-fi movie to be doing. I mean, really, I'm thinking of like, I watch Doctor Strange with my kids, and it's, he does these operating procedures, and it's like the same thing. So
Yep.
that's fantastic.
Thank you.
So it sounds like, I mean, one of the big. I'm getting a note that we have lots of feedback. Do you possibly do you have the live stream open by any chance?
I have the overall screen opened with the website from StreamYard. So should I close one of those or?
If you have the Booth Central open, if you could close it, I think that might help.
Okay, maybe stop sharing my screen. Would that be helpful?
Oh, that might help too. Yeah,
okay.
Possibly. I think that did it. So you mentioned not everyone is a candidate for this kind of surgery. What makes somebody a candidate or would rule them out for it?
Yeah, so patients that are either wheelchair bound or requiring a walker for surgery. Some of those patients are not the best candidates for going home the same day. We have sent patients home that came in on a walker because they even had a small fracture. So once we had replaced their hip and fixed the fracture, they felt fantastic. But again, patients that really are using a lot of assistive devices before the surgery, they may not be the best candidates because we have to show them how to use those devices now that they've just had surgery. So we find that patients that are walking without devices or using a cane, things like that, they're fine to be candidates. patients with a lot of medical conditions, such as urinary retention, overall poor state of health, not optimizing their health before the surgery. We find if we do have to give them narcotics, we find that sometimes they can have a little bit of reaction to the narcotics on the day of surgery. So we really try to optimize the patients to avoid using the narcotics. Patients that live alone, we find that if they don't have family members or friends that can stay with them the night of surgery, patients that have 2 flights of stairs just to get up to their apartment or their house, we find some of those patients might do best staying in the hospital a little bit longer. So it's the overall social situation of the patient, what they're using to walk. If they're using a walker, chances are it might be a little bit different for them to kind of get themselves up and going, depending on their upper body strength on the day of surgery. So all those factors and the overall health of the patient can decipher whether or not they're a good candidate.
No, that all makes sense. We have a question from the chat. How long is the recovery back to 100% with this kind of surgery?
Yeah, so that's just overall. So there are many ways to do hip replacements. So my mentality is the minimally invasive approach. So whether or not that's anterior approach or any of the other approaches, we do say that the first 6 weeks, you tend to make about 80 to 85% of your recovery. So it's a very quick recovery in the first 6 weeks. And that's specifically with the anterior approach, because we've seen that patients will kind of move a little bit faster in the first few months. Over the next 6 to 9 months, I feel that patients will get that last 10 to 15%. So with any surgery, I find that it's a year-long recovery. But quite often I'll see patients in the clinic at 6 weeks and they're either pain-free or they're close to it. Whether or not they're going back to playing golf or tennis at 6 weeks is a little bit variable, but some patients will. Some of my mechanics will be working on cars by then. Patients will go back to work in 2 weeks. I mean, it's really sometimes it's very variable, but 6 weeks, I would say you're at about 80 to 85%. Perhaps by 3 months, you can get to that 100% point, but you do want to keep in mind that it is a major surgery. So if it takes you 6 months, 9 months, 12 months, you'll still be feeling 90% in the first few months. You might just take a few more months to get that last 10%.
Yep. How does this compare in terms of longevity and durability to older methods? Because I have heard of people who've gotten their hip replaced and then they have to do it again in 10 or 15 years.
Yeah, so that's a great question. So early 2000s, we had some new machining of our implants. Some of the plastic had changed. And some of that plastic started in the past had caused a lot of reaction in the body. The body was very sensitive the way the plastic was machined, because the hip replacement essentially becomes either a ceramic and metal ball on a plastic liner that becomes your cartilage, or it could even be a ceramic liner on a ceramic head as well. So when you have that plastic liner in there, 20 years ago, that plastic liner used to be very reactive in the body. In the early 2000s, that plastic material changed and the body really doesn't react to it at all. It's machined in a much better manufacturing way. So since the early 2000s, we've really had our implants last a lot longer because of that plastic, not causing increased wear or excessive wear early on, or that plastic just not causing a reaction inside the body. So really, since that time, we've had the implants last a lot longer. Now, as far as wear, when a hip replacement is put in the right position and the right way, they can fail at about 0.5% per year. This is what we say at the Baptist. So over 30 years, you have an 85% chance that it could still be functioning fine. Now, if you're doing, if it's not done in the proper way and components are not put in the right position or things like that, then over time, it's not going to get that 0.5%. It's going to be a lot higher than that in terms of risk of revision. So we never compromise how small the incision is, for proper implant placement. So we keep it well within a means in terms of being able to see what we need to do and do it properly, because that's been shown in the knee replacement literature that the really minuscule knee replacement incisions, the components were not going in the right spot. So that's fallen out of favor in the last 10 years for knee replacements. So with hip replacements, because we have all this extra technology, such as x-rays and CT-based planning and intraoperative devices, including even robots, we can make the incision smaller and still get that 99.9% precision. So, and still expect this can last 30, 40 years potentially. So
that's fantastic. Wow. You mentioned in your presentation that the technology is very expensive, and the first ever augmented reality hip replacement, just that you just participated in that. How long before you would think this becomes more standard rather than sort of a cutting edge treatment?
That's a good question because a lot of the robotic technology that we have currently, some of that technology has been around since the 80s and 90s. It's just been sort of dialed in a little bit more, but it's the same technology. So, we're seeing a lot more people gravitate towards higher technology. So I would say in the next 5 to 10 years, it might take a similar about half length amount of time in terms of we start to see the augmented reality become a little bit more commonplace because it's been 20, 30 years now, and people are starting to think about robotics and navigated surgery. So, but I think that it's such a cutting edge thing that it'll be about half of that amount of time for a half length. So it might be within the next year we start to see a lot more people using it, but I'd say 5 to 10 years that we'll start to see that becoming more common.
Would it be worth, my orthopedist, for example, has advised me to put off any kind of replacement surgery for as long as possible, which I think is a fairly standard line in orthopedics. Would it be worth a patient waiting to get this kind of surgery done, getting any replacement done for the next couple of years or whatever, if they can hold out? Will this be a better option for them?
Yeah, well, first off, I think that's great advice that your orthopedist gave you because I really think that you really want to put off any major surgery until you really feel like you're ready for it. So, and as far as waiting for this new technology, I think the augmented reality is pretty fantastic. I mean, it enhances the surgical experience, and it also allows the surgeon to see things directly with their hands if the patient's moving during the surgery, because we have micro positioning changes that we see. So I really do think that it's groundbreaking, but the technology that the software is using to plan and use during the surgery, that same hip expert technology using a CAT scan, which is what the robots do. The robots use a CAT scan as part of their preoperative templating. That's been around for years. So if you're getting that kind of software and that kind of data and information that the surgeon can use and template the day or 2 days before the surgery and kind of dial in all the numbers for the positioning devices, I would say you wouldn't have to wait for that augmented reality hip replacement because you're still getting that information and the data. It's just changing the surgery a little bit more with the augmented reality. So I wouldn't postpone it for augmented reality. I would say as long as you have that extra information that the surgeon can use, that checks the alignment of your leg, limb length, and all that stuff, I really feel like that's the important thing at this current point in 2021. Yeah.
Mm-hmm. Wonderful. Thank you. So if people want to find you, where are you?
Well, I'm with Excel. So I'm just down the street from Winchester Hospital. So they're welcome to see us at Excel anytime, to talk about hips or knees or whatever. We have everybody at Excel that I feel like most orthopedists nowadays are just doing one body part. So we've got a whole group of doctors that are all specialized. So I'm happy to chat with anybody or answer other questions. And we've got a team of people there that can definitely direct you to the right direction. So.
And as I've mentioned to others before, Excel is another one of our major sponsors, and I can't thank you enough for supporting this wellness fair. I think it's been a great experience for everybody, and we're getting tons of good information in a lot of different directions. So thank you very much for your support.
Awesome. Well, I'm excited to be here. I think Excel has been wonderful, and this is a fantastic idea. I mean, one of the blessings is the virtual get-togethers seems to be a great idea, especially for something like this. So.
Yes, and we're really enjoying the fact that it's not, nothing against Zoom, but we're really appreciating that it's not another Zoom screen with the breakpoint array, right? It feels a little bit different.
Correct. Yeah.
Well, thank you so much, Dr. Connors, and we really appreciate it. And
no problem.
Go check out the Excel booth and see what they've got going on in there.
Sounds good. Have a good day.
Thank you. You too. So before we move on, because I believe next up we actually are getting a demonstration on how to improve your golf swing or get it ready for the spring, which I think it'll be pretty cool, from Melrose Wakefield Hospital, another one of our major sponsors. I wanted to mention a couple of just sort of procedural things about the live chat, for example. Please pop into the live chat on the main screen of Booth Central and ask questions. We can we're making sure we monitor that so we can pass them on to the presenters. So definitely go ahead and do that. The other thing, and Dana keeps mentioning this in the chat, which I really appreciate. We're having a raffle going on. So just by being here, you're already eligible for the raffle and you're entered in. Excuse me. But every time you go into a new booth, that's an extra chance to win. So the Booth Central technology actually, excuse me, the Booth Central technology actually lets us know how many booths different people attended and things like that. So we are going to be taking a look at that, and however many unique booths you've entered in, that will be the number of raffle chances you have. And the prizes are pretty fabulous. We have, $100 gift cards to Arlington restaurants. We have $100 gift cards to Stoneham restaurants. We have several $100 gift certificates to a new business called Stretch Med in Winchester. And that's a place for, it's kind of somewhere in between physical therapy and, say, yoga or massage. It's kind of it's professionally stretching you out and helping you recover, especially from injury or from excuse me, post-workout. So please, make sure that you are jumping in, and many of the vendors also are running some raffles within their booths. So, all right, it looks like we are just about ready for the presentation on swinging into spring. So if you are a golf enthusiast, make sure you are watching. Not that we don't want you in booths, we want you in booths, but take a moment to follow Andrea Hogan. She is actually certified through Titleist Performance Institute. I assume that has to do with the Titleist golf company. So she's going to talk to us about getting your golf swing ready.
Everyone, I'm Andrea Hogan, and I'm a physical therapist with Melrose Wakefield Healthcare. I specialize in golf prevention, injury, and rehabilitation. So spring is coming, which means nice weather, which means it's time to hit the driving range. So with that being said, we need to make sure that everyone can do so this year in a safe fashion. So what I'm going to do in the next 5 or 10 minutes, we're going to go over some warm-up activities and then a few strengthening things you can do before we actually hit the links this spring. All right, so how we're going to start. A few little stretches that we can do in the golf cart, at home. So what you're going to do is you're going to take one leg, ankle on top of your knee. You're going to put your hands right on your hips, and all you're going to do is lean forward. We're going to stretch some of those nice muscles in our glutes. So same thing, you do it on both sides. And then the next muscle group, we're going to stretch our hamstrings, something else we can do from the golf cart or at home. So you're going to put, again, hands on your hips, foot right in front of you, toes up towards the ceiling. All you're going to do, push those hips backwards, bring that chest down towards your leg. You'll feel a big stretch right through the back of that leg. Again, something to be done on both sides. And then, because everyone's itching to get a golf club, you're going to take a golf club. You're going to put it right behind your lower back. You're going to put your hands right on either side. And all you're going to do, feet firmly on the ground, shoulder width apart, and you're going to rotate. Left, and then right. Something to warm up all those nice rotating muscles that we use in the golf swing. Very good. And then with that being said, onto our shoulders. So you're going to take this golf club, hold it right in the middle, firm grip. You're just going to bring that palm up to the ceiling and then bring it back down to the ground. Very good. And then, so if the head of the golf club is going this way, you're going to flip it to the other direction. Again, same way to hold it, arm right in front of you. Palm's going to go one way, then you're going to bring it the other. So that's going to warm up our rotator cuff and our wrist muscles to make sure that we can properly hold that golf club. Very good. So now on to some of our strengthening exercises that are very important as we head into the golf season. So golf is actually a sport that uses every muscle in the entire body. So our big areas that we need to hit are our core and our glutes. They're what give us a lot of the power when we get into our backswing and come all the way through to impact. So we're gonna start with a one-leg bridge. So what you're gonna do is lay down on a bed or a table. You're gonna bend your knees, and then you're gonna take one foot, put it right in the middle of your body, and the other leg is gonna go straight up towards the ceiling. So what I'd like you to do, squeeze those butt muscles together, and then lift up off the ground. So you're gonna lift this bum off the surface, and then you're gonna come back down. So you do that about 10 times on each side for glute. So then we're gonna do, again, some other things while we're standing, again with the golf club. So you're gonna take your golf club, you're gonna hold it just like you would, I'm left-handed. So you're gonna hold it this way, and all you're gonna do, one foot on the ground, you're gonna put that other one, either tap it down behind us to start, or if you're feeling daring, pick it up off the floor. You're gonna choke up a little bit on the head of that, on the golf club, and all you're gonna do, go through a little range of motion. So again, nothing very exciting into a backswing, but it's a little bit of work to fire, again, more of those glute muscles and a little bit of that core. And then as we get a little bit more advanced, you go further one way and the other, just like that. Very good. So another core exercise that we can do. So I'm sure at some point during quarantine, everyone has bought some type of fitness equipment that they have at home. So what we're gonna use here is just pretty much a stretchy cord that we use for exercise in the clinic. And then what you're gonna do is attach the other end to a stable surface. So you can stick it in between a door and then close the door, wrap it around a pole, anything like that. So you're gonna, again, feet shoulder width apart, nice stable stance. You're gonna bend those knees just a little bit to protect our lower back. And then for your core, you're gonna tighten those tummy muscles, like you're trying to get your pelvis to dip in, so there's a little, little cave where our belly button is. So you're gonna hold your hands right together in the middle of your chest, and all you're gonna do, keep everything nice and engaged, tighten that tummy muscles, and then push it straight away from you. That's it. So think about it this way. It's a nice golf-related stance, like this. Hold this right in the middle of our core, tighten those tummy muscles, and push it straight out in front of you. So over time, this is gonna get really challenging. And you're gonna fire everything on the side of the body that your arm is on, okay? So for an exercise like this, you would do both sides. And then as that gets easy, you can do different motions. So a big, awkward steering wheel, think of it that way. Or like a cog in a wheel, just like that, very good. And then you can go the other way as well. Very good. So that's a little thing that you can do at home before you even get to tee off at the first one. So, all right, guys, nice to talk to you. See you on the links.
What is home care? Home care is a care option that allows an older adult to live in his or her own home and be cared for by a professional. Home care services can often vary, depending on the older adult's health scenario. They can include things like personal care, bathing assistance, transportation, and specialized Alzheimer's care. Home care is also flexible in scheduling, ranging from a few hours per day to around-the-clock service. Most providers will create a unique care plan tailored to the needs of the individual. Then from there, a schedule is set for a professional caregiver to arrive at the appointed times and provide one-on-one care in the home. The three most common reasons for home care: 1. Life enhancement through social interaction and companionship. This includes such things like cooking meals, playing games, and transportation to appointments. 2. Acute care for chronic conditions such as Alzheimer's and Parkinson's disease. 3. Safety of having someone to provide personal care and administer medication, reducing the possibility of pandemic exposure. To find out more about home care, visit homeinstead.com.
Hello, my name is Dr. Anya Garlitsky, a cardiac electrophysiologist at Melrose Wakefield Hospital and co-director of the Cardiac Arrhythmia Center at Tufts Medical Center. I'm here to talk about the importance of maintaining regular heart health screenings and scheduled appointments as suggested by your physician. As an electrician of the heart, it's my job to work closely with you to keep your heart in perfect rhythm. For many, that means regular management and testing of your heart. The difference in detecting any changes in your heart function now, as opposed to 1 month from now, could significantly change the diagnosis and treatment options for heart failure or arrhythmia. Changes in heart rhythm can occur with little or no symptoms, making the need for regular diagnostic screening vitally important. We make it easy by providing comprehensive heart care right here in the community at Melrose Wakefield Hospital. So please don't delay or put off your tests or appointments. If you are concerned about coming to the hospital or your doctor's office, I want to assure you that we are using all of the established protocols to keep our patients, our visitors, as well as our staff safe. Our cleaning regimen includes continuous use of safe, clinical-level disinfectants and ultraviolet light. All patients are screened and tested before their procedures, and our staff are screened and wear appropriate personal protective equipment at all times. If you are due for a doctor's visit or exam, please call and make that appointment and stay safe with us.
My name is Dr. Brian Clark, Chief of Gastroenterology and Medical Director of Endoscopy at Melrose Wakefield Hospital. I'm here to talk about the importance of getting screened for colon cancer. Scheduling a colonoscopy could save your life by finding colon cancer early or preventing it altogether. If you are concerned about coming to the hospital, I want to assure you that we are using all of the established protocols to keep our patients, our visitors, and our staff safe. All patients coming into this unit are screened and tested to ensure they are negative for COVID, as well as all employees are screened for any symptoms before coming to work each day. We use rigorous and safe cleaning and disinfectant regimens continuously. We have implemented social distancing, and we will ensure all patients are provided an appropriate mask to be worn. Our staff also wear personal protective equipment at all times to protect you and each other. So please don't delay your care. If you are due for a doctor's visit or exam, please call and make that appointment, and stay safe with us.
My name is Dr. Sam Nardello, and I'm a surgical breast oncologist here at the Melrose Wakefield Breast Health Center. Annual mammograms are the best way to detect breast cancer, and it's very important to keep your scheduled appointments as suggested by your physician. And the difference in detecting breast cancer now versus several months from now could significantly change the diagnosis and treatment options for later stage cancer. I want to assure you that we are using all of the established protocols to keep our patients, our visitors, and our staff as safe as possible. All of our patients are screened and tested before their procedures, and our staff are screened and wear the appropriate personal protective equipment at all times. If you're due for a doctor's visit or exam, please call and make that appointment, and stay safe with us.
The Artist Way in Action allows every individual, every resident here a chance to be who they are. We try to find out things that they enjoy doing the most, and we seek to respect them and treat them as an individual and as an adult. We encourage friendships and we encourage purpose, and we just encourage them to be who they are and to be the best they can be.
You want to go somewhere and know that you have friends or you meet people, but you still can be on your own to do what you want to do.
The A for artist stands for the ability to have a voice. And we have a resident named Dan who came here as a pretty upset man. His children, his two girls, were concerned that they couldn't find a community for their dad that would allow him to enjoy his love of the outdoors and to take his daily walks. So when they came to Artis, he was depressed and very withdrawn. And over the course of the last few months, he's been able to have his voice heard. At a town hall meeting, he talked to John about being able to be outside and walking, even if the weather was a little bit inclement.
I like to be outside, yeah.
He loves to walk here, I do believe, because I feel like that's his choice, it's his decision, nobody's stopping him. They let him walk out the door pretty much when he wants to. So it's pretty much as close to independence as he can get right now.
We also have had fun watching him develop some friendships as he's enjoyed his walks, and he and Bessie are out here a lot, and that's been a fun relationship to see blossom as well.
He has that quick wit and great sense of humor that my family and I have not seen probably for 2 or 3 years. And to have that piece of my dad back again is one of my favorite things since he has been here. It's almost like we have Dad back, and it is wonderful.
The R in Artis stands for respect and maintain relationships. We have 2 families here that have had a really fun story in that Al's daughter is married to Asta's son. Al was our resident first, had moved in here after several other communities didn't work for him, and really excelled here. And when Asta's family saw that, they decided this would be a good place for her to come as well. So they already have many years as a family together, but they've been allowed to continue that here. And the families have intertwined and have really been able to stay in touch a lot more and seen both their loved ones really come to life here.
Did you raise them in your backyard, Asta?
I had some flowers.
They care for each other. Again, from a long relationship of being family friends. And I think my mother has a lot of high esteem for Al because of the kind of man he is. So it's a very warm relationship.
The T in Artis stands for treasuring each person's uniqueness. One of the tools that we use to discover that is a partnership profile that we ask the families to fill out before they come, which gives us a lot of great background information on our residents. And one of the things we discovered about Betty is her love for puzzles.
No, there's still, she has to have that little bit of green on it.
The stories I hear from my mom about her love for puzzles are the memories she has with her daddy most of all.
Daddy always had puzzles.
Yeah.
She and her dad used to do puzzles together for many years, and she often talks about that, and those are wonderful memories for her. So she has her corner set up where she enjoys her puzzles, and her daughter comes and enjoys doing those with her. She's completed numerous puzzles that we have been able to frame for her and distribute around the community. Al and his son Tom have a shared love of old cars, and we've heard a lot of stories about Al and his old Model A's way back in the day.
His first car was a Model A Ford, and my uncle taught him how to drive it.
I put my foot in on that clutch and shifted it, and it ground. I finally got onto it. It took a while.
And his son Tom now has a Model T Ford that he has brought to Artis several times to share with the residents here. And they get to drive around the flagpole a few times and kind of take a ride back down memory lane and have a really good time. The I in Artis stands for integrity, which is basically doing the right thing. Integrity for us kind of stretches into just getting people into the right role as well. And for Asta, she came in rather quiet and rather concerned about meeting other people. Even though she was a people person, she took a while to kind of adjust to really into that role. But we asked her if she would be our ambassador and welcome new residents to the community. And she has just been a gracious woman and doing that in just a wonderful way.
Well, my mom has always loved people. She's always got along with everybody. And she's very family oriented.
She's also helped us in our recognition of our different employees throughout the months. And Asta helped us honor our nurses not long ago and very sincerely thanked them for being such great nurses.
Well, I'm very proud of my mother that she's been named an ambassador because she is truly a goodwill ambassador at Artis.
The S in the Artis Way stands for success and recognition. One of the things that we have done that has been a great success has been to include our residents in making welcome gifts for new residents. And one of the best things we've done is to allow them to help us create these beautiful fleece blankets. So we'll have several residents lined up around the table, and they own this job. They are very determined, very focused, and very eager to give it their best to make this a beautiful gift for a new resident. Our very first blanket was done for a Bengals fan. She owns that and loves it. One of the things we have found that has been really fun is to take some of our longtime bowlers bowling again, for the first time for some of them in many, many years, and they have really come to life. Dora is another one of our longtime bowlers who has really enjoyed her trips bowling. We've tried to do those once a month, and she's always on that list because she may be in her 90s, but she is a very agile woman and loves, very competitive, and really enjoys her bowling. So to see her get to do that and cheer others on.
Did we ever think we would ever see our mother do anything like that again? Absolutely not. We feel like she looks younger, she acts younger, she is more like her old self.
Huge sense of relief off of my shoulders and my sister's shoulders. Sorry. To know that he is content and happy and safe.
Come on, come on. Knock it over. Knock it over. Come on.
Hi everyone, I'm Andrea Hogan and I'm a physical therapist with Melrose Wakefield Healthcare. I specialize in golf prevention, injury, and rehabilitation. So spring is coming, which means nice weather, which means it's time to hit the driving range. So with that being said, we need to make sure that everyone can do so this year in a safe fashion. So what I'm going to do in the next 5 or 10 minutes, we're going to go over some warm-up activities and then a few strengthening things you can do before we actually hit the links this spring. All right, so how we're gonna start. A few little stretches that we can do in the golf cart, at home. So what you're gonna do is you're gonna take one leg, ankle on top of your knee. You're gonna put your hands right on your hips, and all you're gonna do is lean forward. We're gonna stretch some of those nice muscles in our glutes. So same thing, you do it on both sides. And then the next muscle group, we're gonna stretch our hamstrings, something else we can do from the golf cart or at home. So you're gonna put, again, hands on your hips, foot right in front of you, toes up towards the ceiling. All you're gonna do, push those hips backwards, bring that chest down towards your leg. You'll feel a big stretch right through the back of that leg. Again, something to be done on both sides. And then because everyone's itching to get a golf club, you're gonna take a golf club. You're gonna put it right behind your lower back. You're gonna put your hands right on either side. And all you're gonna do, feet firmly on the ground, shoulder width apart, and you're gonna rotate. Left, and then right. Something to warm up all those nice rotating muscles that we use in the golf swing. Very good. And then with that being said, onto our shoulders. So you're gonna take this golf club, hold it right in the middle, firm grip. You're just gonna bring that palm up to the ceiling and then bring it back down to the ground. Very good. And then, so if the head of the golf club is going this way, you're gonna flip it to the other direction. Again, same way to hold it, arm right in front of you. Palm's gonna go one way, then you're gonna bring it the other. So that's gonna warm up our rotator cuff and our wrist muscles to make sure that we can properly hold that golf club. Very good. So now on to some of our strengthening exercises that are very important as we head into the golf season. So golf is actually a sport that uses every muscle in the entire body. So our big areas that we need to hit are our core and our glutes. They're what gives us a lot of the power when we get into our backswing and come all the way through to impact. So we're gonna start with a one-leg bridge. So what you're gonna do is lay down on a bed or a table. You're gonna bend your knees, and then you're gonna take one foot, put it right in the middle of your body, and the other leg is gonna go straight up towards the ceiling. So what I'd like you to do, squeeze those butt muscles together, and then lift up off the ground. So you're gonna lift this bum off the surface, and then you're gonna come back down. So you do that about 10 times on each side for glute. So then we're gonna do, again, some other things while we're standing, again with the golf club. So you're gonna take your golf club, you're gonna hold it just like you would, I'm left-handed. So you're gonna hold it this way, and all you're gonna do, one foot on the ground, you're gonna put that other one, either tap it down behind us to start, or if you're feeling daring, pick it up off the floor. You're gonna choke up a little bit on the head of that, on the golf club, and all you're gonna do, go through a little range of motion. So again, nothing very exciting into a backswing, but it's a little bit of work to fire again, more of those glute muscles and a little bit of that core. And then as we get a little bit more advanced, you go further one way and the other, just like that. Very good. So another core exercise that we can do. So I'm sure at some point during quarantine, everyone has bought some type of fitness equipment that they have at home. So what we're gonna use here is just pretty much a stretchy cord that we use for exercise in the clinic. And then what you're gonna do is attach the other end to a stable surface. So you can stick it in between a door and then close the door, wrap it around a pole, anything like that. So you're gonna, again, feet shoulder width apart, nice stable stance. You're gonna bend those knees just a little bit to protect our lower back. And then for your core, you're gonna tighten those tummy muscles like you're trying to get your pelvis to dip in so there's a little, little cave where our belly button is. So you're gonna hold your hands right together in the middle of your chest, and all you're gonna do, keep everything nice and engaged, tighten that tummy muscles, and then push it straight away from you. That's it. So think about it this way. It's a nice golf-related stance, like this. Hold this right in the middle of our core, tighten those tummy muscles, and push it straight out in front of you. So over time, this is gonna get really challenging. And you're gonna fire everything on the side of the body that your arm is on, okay? So for an exercise like this, you would do both sides. And then as that gets easy, you can do different motions. So a big, awkward steering wheel, think of it that way. Or like a cog in a wheel, just like that, very good. And then you can go the other way as well. Very good. So that's a little thing that you can do at home before you even get to tee off at the first one. So, all right, guys, nice to talk to you. See you on the links.
Hi, well, we're back. Coming back to some of the live portion. I want to welcome everybody to the Health and Wellness Fair. I know I'm kind of guessing that most of you have not been with us since 10 a.m. So I'm going to do a quick reintroduction of everybody. So first of all, I want to acknowledge my colleagues from the other chambers of commerce who have worked so hard to put this together. This is a collaborative effort between 6 different chambers of commerce. And I want to make sure that I acknowledge all of the work that everybody has put into this. So from Arlington, we have their executive director, Beth Locke. From Malden, we have Joan Mongeau. who is the executive director there. In Stoneham, we have Megan Day, the executive director for their Chamber of Commerce. Melina Richards is the executive director for the Waltham Chamber of Commerce. And Dana Garmy is the associate director for the Winchester Chamber of Commerce. So we have worked for a couple of months now to put all of this together, and we couldn't be doing it without all of our sponsors as well. So please be sure to visit their booths and watch their presentations, connect with them. And I think next up, we're having a Pilates demonstration, which should be very nice, with Mia Melendez from the Metro North YMCA. She is a certified Pilates instructor and has been working with Pilates for over 20 years. Before she speaks, we have Bernadette Farrell. She's the wellness director from the Melrose YMCA, and she's going to speak first. Hi.
Hi, thank you so much. And thanks to everybody who's attending today. I just want to talk a little bit about the Y itself. The Melrose Y strives to strengthen our communities by developing the body, mind, and spirit. We are more than just swim lessons for kids. We ran a remote learning program during the pandemic to support families that were working. We're more than Stay Fit for seniors. During this pandemic, we proved to really counter the isolation that a lot of seniors felt, not being able to see family and friends like they had in the past. And we're more than just a gym or fitness center for adults. We have wellness programs and evidence-based medical programs that include Live Strong for cancer survivors, enhanced fitness for arthritis sufferers, cardiac rehab maintenance program which we ran with Melrose Wakefield Hospital, and also Pilates programming, one-on-one, as well as mat Pilates in group settings with our Pilates instructor, Mia Melendez. And without further ado, I'd like to introduce Mia and continue. You got it. Take it away.
Thank you. Hello, everyone. My name is Mia. I'm a nationally certified Pilates instructor, and I'm on board, on staff at the Melrose Family YMCA. And a lot of people think that Pilates is kept for, small private little studios, but I am very passionate about community health, as Bernadette said, and we want to bring health and wellness to our community, and I believe that Pilates should be open to everyone. So if you're not familiar with Pilates, I'm going to give you a little snapshot of what's entailed here. And you're also seeing that I have a lot of funny equipment behind me. And then that's part of the process, and I'll do some demoing on that as well. So Pilates was started in the 1920s from Joseph Pilates himself. He was an exercise aficionado and studied all kinds of forms of strengthening routine and calisthenics. And he helped to train boxers and all different, sports and people during that time. But he didn't really perfect his technique until he was in World War I. And he had the opportunity to help heal wounded soldiers, and he used his techniques, he used all of his know-how, and he found remarkable results. And so he started forming his exercise program based on those results. And he didn't call it Pilates at the time, he called it Controlology. And it was this idea that if you can isolate and differentiate different parts and muscle groups of the body, that when they all worked together, they worked more in unison, and that the biomechanics of the body and how we live within our body was so much improved. And so during his lifetime, he helped to train dancers and acrobats and all kinds of sports and fitness people, but it was really his dream that he would bring this into schools and to seniors facilities, because he thought that the people who could benefit from his programming most were young people, so we teach them how to live in their body, and then the aged, because we want everyone to be able to have a body that lasts a lifetime and that everyone has the opportunity to age with grace. So much of what we do in Pilates is controlology. It is strengthening different muscle groups one at a time. When I see private clients, I have people from all walks of life. I have people who are athletes who know that they need to counterbalance their routines and focus on those small muscle groups and not just the large muscle groups that you would use for running or for athletic performance. I also have a lot of seniors who see me for their hump prevention program to make sure that we're getting out of a kyphotic position. I also have a lot of postnatal clients who want to restore their abdominals and their body positioning after childbirth. But regardless of the people who come to me, my goal is to always have someone feel better when they leave the studio than when they first walked in, and that everything we do in studio is to help aid them in every other aspect of their life. If you've taken a mat Pilates class, you've experienced, that deep core sensation, but I'll be honest with you, mat Pilates is hard. I even know of Pilates instructors who themselves barely practice mat Pilates because it's so challenging. Holding your own body weight, all of those core exercises with your legs and your arms up in the air, they're not for everybody. And so that's where the equipment comes in. I can replicate a lot of the positions and exercises that we would do in a mat class, but with equipment so that it's not as challenging, and I can take the resistance away little by little over time to really help strengthen all of those stability muscles, especially with all of the springs and settings and straps that we use on the equipment. We can strengthen arms, we can strengthen legs, whereas some of those mat exercises don't allow us the full kinetic chain. And so I'm just going to show you a couple of assessment tools that I use when I have a new client. I'm going to have Bernadette as my example, and she's just going to stand up against the wall. So we're often known in Pilates as the posture police, because when we talk about controlology, we want to make sure that when we're strengthening all of those muscles, that at the end of the day, it's strengthening our posture so that we're moving effectively in our body. So I'm just going to have Bernadette go through a couple of movements. You're going to move over to the side so you can see her. And this is something I would typically do with any of our clients. And as Bernadette said, we offer our Live Strong program at the Y, and I help to run that program. And it's pretty eye-opening when people use this little wall assessment right at the beginning of their sessions, because it can be eye-opening about seeing where their own posture may have some deviations. So Bernadette, I'm going to have you bring your feet about a foot away from the wall, and then you're going to lean your back up against. You can use your arms to help brace yourself, and then you're stacking tall. So if you're following along at home, you can do this same movement alongside of us. So again, I have Bernadette's legs a little bit further removed against the wall, and then the rest of her body is up against the wall. And as an instructor and as a layperson, what you're looking for is that your pelvis, the back triangle, right above your bottom is up against the wall. So you really have to use the front body to draw the back body into the wall. I would want your ribs to be up against the wall. So notice if you feel any gapping or a big arch of your back. So I'm gonna have you place your hands on your ribs, and we're just gonna chuckle. And then you can feel all of those muscles kind of tighten and retract and pull into the back body. I'm also looking at the shoulders. I want to make sure that the shoulders aren't rounded off of the wall and that they're back, and then it's opening up our chest. I want to make sure that the back of the neck is nice and long. And I'm also looking for her head placement. I want to make sure that Bernadette's eyes are gazing straight ahead, and that the back of the head, right behind the bridge of the nose, is weight bearing into the wall. If you're doing that with ease, you're in a good place. If you felt like your head was really far off of the wall, and when I instructed you to pull it back, it felt quite abnormal to you. If your shoulders were rounded forward and off of the wall, then that's an area of opportunity too. And then those ribs. So many of us live with our rib cage out in front of us, and that actually shortens our breath and our ability to breathe fully into our diaphragm and into our lungs, causing a lot of mid-back tension and also shoulder displacement. And then lastly, the pelvis. Did you feel a large curve in the back of your body? Then we have some areas of opportunity. So just a great little check if you have time throughout your day. I even use this throughout my own practice throughout the day. If I've been standing all day and I feel a little fatigued, I'll use that wall. It just gives me such great feedback. And I was just telling Bernadette a story the other day. You can step away from the wall, Bernadette. That I had a client who I had told them we were working on their head positioning and their neck, that the headrest in their car is actually for their head. And she had a very visceral reaction to that statement, because we're not living that way in our body. Think about how many of us, when we are reading and answering text, we're here. When we're riding a bicycle, we're here. When we're on our computer warriors all day, we're here. So we're losing a lot of spinal extension. We're losing the ability to hold our own head up straight. And when these things are misaligned, it affects our breath. It affects our shoulder placement, can cause and exacerbate osteoporosis. So there's so many reasons to really pay some good attention to your posture, and that's what Pilates is all about. We're always looking for exercises to help to strengthen a person's positioning so that it makes them a little bit more efficient in their body, and that they're able to go out and be active, whatever that is. Maybe it's just being able to carry a laundry basket up their stairs, but do that with ease where it doesn't affect the knees or the necks. Or maybe they're playing golf. Maybe they want to start running again. Whatever the activity, Pilates will just help to enhance everything that you're doing. I also wanted to just spend a couple more minutes. I'm talking about another program that we're going to be kicking off at the Y soon, and that is our MELT program. So MELT is a state-of-the-art neurofascia release program. It is the only one of its kind. It's medically based, and it has been proven to help treat back pain, neck pain, and really ease compression in our joints. And so we're going to do one more little assessment together. When our joints and the fascia, all of the connective tissue in our body is dehydrated, it becomes really tricky for our body to know where our limbs are in space. And that can cause imbalance, compression, it can cause pain. And then just imagine you're cutting vegetables and you glance away for a moment. If your body can't recognize where its limbs are, we can be in trouble there. So we're gonna just do a quick assessment you can do at home. I'm gonna have you bring one pointer finger, and you're gonna keep your eyes open, and we're gonna bring that arm overhead. And so now I'm gonna close my eyes. I'm going to take the other index finger, and then I'm going to try to bring my fingertips to touch. I was a little off, but where were you today? Were you way off? If so, that's a sign that we have some autopilot inefficiency going on, and we could benefit from a program from MELT. MELT uses a series of soft balls and rollers to apply very minimal compression, kind of hands-off body work to help to rehydrate dehydrated tissue and help restore the connective tissue systems in our body. So we look forward to launching that program late spring. Private Pilates sessions are available to all of our members at the Y. They're part of our personal training program. And we also offer group exercise mat classes as well. And as things begin to open up, I do have some specialty programming. I have offered chair Pilates to some of our seniors, and I've also offered prenatal and postnatal Pilates programs as well. So if you're interested in learning more about the programming that we're offering at the Y, where everything is listed on the Melrose Y webpage, you can find Bernadette's information there as well as mine. I hope that you enjoyed our little program here about what we have to offer as the Y, and I thank you for your attention. I wish you all good health and happiness and happy spring. Thank you for joining.
Thank you so much, Mia. That was really informative. I have done Pilates for probably close to 10 years, and the alignment on the wall is not something that I've ever tried. And I can imagine that it's it's going to point out some things that even when you think you know how to do Pilates, or that you're comfortable in your body, or those kinds of things, you can learn new information about it.
Yes, and you know, it's something that I like to think about with the wall, it mirrors the mat. So when we're down on the mat, we want to feel all of those same points, making contact with the mat. But I like the wall because everybody can get up against the wall, even if you have mobility problems, and it's a good just little check-in at any point of the day.
One more question before we let you go. The MELT program, is that only being offered at the Melrose Y, or is that something that's coming to Ys more generally?
That is a training that I have initiated. Okay. So right now it'll just be offered at the Melrose Y, and we're hoping as things begin to open back up that I might be able to offer that programming throughout the Metro North Y Association, which would include Saugus, Lynn, and our Peabody branch as well.
That's exciting. Thank you. Thank you for sharing all that. And please thank Bernadette for being such a patient demonstrator.
Yes, I will. Thank you very much.
Great. So we actually, coming up next, we're going to have a video from Bear Fitness, which is another Pilates studio actually. And Laura Williamson is the owner of that. And let's see what she has for us.
Good morning, everyone. It's Laura from Bear Fitness. I have something special for you today. Today we are doing a demonstration. I wanted to show you a little bit of what it is exactly that I do here. I know you guys, you see my videos, and they're posted on Instagram and on Facebook 2-3 times a week, but I actually wanted to show you a real live person. So she is in the studio with me today. This is Ruth. Everybody say hi to Ruth. And she's going to show you a little something. Ruth and I, we've been working together for some time now, and Ruth does personal training and she does Pilates. So she's been with me since, the beginning. From the very, very beginning. Actually, Ruth was one of my original bodies when I even went through the Pilates program, and that was almost 17 years ago. So this is a long-standing relationship. She's at my wedding, everything. So she's still a client. She's still with me. And so she's going to show us a little bit what she does and what I do. And I'm going to talk through it all, okay? So we're going to start on the barrel. So here's the thing with the barrel. The barrel is another piece of equipment in the Pilates order. Most people have heard of the reformer. You've seen jokes about it on TV. Maybe you've even taken some classes, but you don't always hear about the other pieces of equipment, which are also very cool and a lot of fun, and they help the body in a lot of ways. And so I think that, when it comes to working out, flexibility and mobility is important so that your movements are efficient and you can get stronger and move better. So a couple of ways that can be done is through Pilates and obviously through stretching and rolling out and foam rolling and using a lacrosse ball. And I keep looking that way because I have more equipment over there that you're going to see as we go. But Ruth is going to show us a special exercise today, what is called Swan, which is a very cool exercise. I've posted a couple of videos of myself doing Swan, but like I said, it's nice to have another person besides myself show you Swan. And she does a pretty decent Swan. It does take some time to work up to it, but as I said, she's been working with me for a while. But this could be you too. easily. But the barrel, just to give you a little information on the barrel, this barrel is awesome for, again, flexibility, helping you to stretch out, stretch the backs of your legs, stretch your spine, open up the chest. You know, Pilates in general is great for flexibility, mobility, decreasing pain, but more importantly, it's just good for overall health. And again, if I didn't say it initially, I'm on 38 Montvale Ave. Again, this is Bare Fitness. So I'm talking about Pilates now, but I also offer personal training and health coaching. We're going to touch on the personal training a little bit too, because we want you to see how it all comes together. So let's start. Let's not wait. Show us your swan. And I'm going to walk around. We try to social distance here. You notice we have our mask on, keep you safe. All right, so here she goes. Oh, wait, no, out. Back. And so this is a traditional swan. You hear my voice. You don't see me, you see her, because she's doing a fantastic swan. And we usually do this 3 times when we're doing swan. And as you can see, she looks really good because she's done this a while. And by the way, we work without shoes here. She looks really awesome. And rest and come down. And so, yeah, that's our swan. So, Ruth, how did that feel?
That was great.
Yeah?
Like, you know, a lot of flexibility, which is always my my downfall.
Yeah, yeah.
So it was great.
Why did you start with flexibility? I mean, why did you start with me? Because you've had a couple of things in the past, and guys, I'm just walking around. If you don't see me, I'm still here.
I mean, it was one of the things that was really important, I felt like, for me to do as part of my post-back surgery rehab.
Mm-hmm.
And now that I'm, I don't know what, 10, 12 years post-surgery, I continue to do it because I have no interest in surgery round 2, because that's no fun.
No one likes a lot of surgery. So I think we were personal training. We were doing personal training at the time. And then you had the surgery, and then we had the rehab. You rehabbed, and then we had to kind of start ease you back in again.
Ease back into Pilates.
Yeah.
But it's been great.
Yeah, and that was, oh my gosh, that was how many years ago? That was a while ago, right?
2010?
Yeah.
2010.
Yeah, so where does the time go? So, you know what? There's more equipment. So we're gonna walk on over. Follow us this way. We are gonna show you another piece of equipment, and it is the chair, the Wonder Chair. So now, I'm gonna bring it over here. If you see that little guy there, that is the Wonder Chair, because it is just oh so wonderful. Now, for this one, this is gonna be cool, because this is another one that a lot of people aren't as familiar with. They don't see it being used very often, because again, most people use the reformer. But the thing is there's so many other wonderful pieces in the order in Pilates. And again, we're not only talking about Pilates today, we will talk about personal training because we offer both. And if you notice, she's pulling up. There's a lot of ab working here. And pull up. Actually, Ruth, pull up and hold and stay there. Hold and come down slow. Slow. Touch the floor, and come right back up again. Up. And hold the position, hold it, and come down slow, and rest, step away. So again, this is the Wonder Chair. This works directly here, and it's a lot of fun to use this. And as we know, like I said, Ruth has been working with me for a while, so she's pretty experienced in a lot of the pieces of equipment that are in the order in Pilates. And today is a good day. So, you know, no 2 days are the same, but you definitely want to give this a try. And then lastly, let's talk about the personal training side. We're going to go on over to the kettlebell. So if you notice, we're going to go on over here. So head on over, Ruth, for us. And I'm going to lower this for you guys so you can see her. And if you noticed, there's a kettlebell there. So what you don't know about Ruth, Ruth is the queen of squatting. She's really good. She's awesome at squatting. So from here, you're going to see her do a squat as she holds the kettlebell. And come on up. So I'm a huge fan of kettlebells. And up. So, you know, the trick with doing squats, because a lot of people have knee problems and complications these days. is working in your level. And we do that in Pilates too. And if you notice, see, look, she does a beautiful job with her squat. And again, we're socially distanced. We keep it 6 feet apart. We wear our masks. And I check your temperature when you come, so you feel safe. And we're a pretty small space. You know, and when you're working out, I play a little music for you if you like it. And yeah, that's Ruth. So we're going to finish up. We're going to come back to the chair. And again, these are ways, actually, before you stop, let's change your, let's make sure you're on the right. Yeah, let's change that. That's not right. Okay, now, you can have a sit down. And so, put your feet on top. And again, this is the chair. And so, you know, that's pretty much what we do here.
What, arms? Or?
Yeah, let's do arms. Pull in, flatten out your spine. Put your belly button in and down. Rib cage pulls in. And keep it flat, neutral spine. Keep your tailbone under, try not to rock your body. Only move the feet and pull up. And so, yeah. So this is what we do here at Bear Fitness. We are, again, Pilates. We are personal training and health coaching. So if you need help with nutrition and foods, if you're trying to lose weight, if you're trying to gain weight, if you just want to feel better, you know, that's what we do here. That's what we're here for. And that's about it. And bring your feet all the way up, Ruth, and relax yourself. No more. And yeah, that's it. So we would love to see you come visit us. And we're both here. And again, this is Ruth, and I'm Laura. Granted, she should work here because, you know, we've been together for so long, working together. But at any rate, yeah, we would love to have you here at Bear Fitness, 38 Montville Ave. If you need to get in touch with me, you can email me, info@barefitnesspilates.com, or you can also check out my videos. I post regular workouts 2-3 times a week. You can find me on Facebook, Laura's Bear Fitness. Same name for Instagram.com too, Laura's Bear Fitness. And you can find my videos and you can find me. All right, so I look forward to seeing you soon. If you need anything, just reach out. I'm here. You guys have a great day, and thanks for watching. Bye.
Originally, I had back surgery. So I was unable to walk. So that was a long, arduous trip and very, very painful. She had a good feeling for what I was going through. Unfortunately, she lost her mom. So that we kind of lived through that together. So that was a very painful time for her. And it became painful for me because I became so attached to her. And that's what happens when somebody takes really good care of you, you get attached. So that's kind of the story of Sandy and Nora.
My name is Nora T. Nandudu. I love Assisting Hands so much because they are a good team. They consider us as not as workers, but as a team, like working to help the community to another level. So I love how they treat us. I look forward meeting Sandy because she's and Bob, the husband, because she's a great person. I look forward to having those moments of laughter throughout the day, but as well coming to make sure that I create a difference in Sandy's life, that she feels that she has someone who can be helpful and make her day complete, because I'm able to help her take the shower with the fear of falling down. So she's had that confidence around me that she cannot fall down. I'm able to drive her out there, and she has the confidence Nora is taking me wherever we are going, she'll be back safely. So I feel that reliability of Sandy, and I take it upon me that I have to do my best such that we keep ourselves together for whichever time God has arranged for us.
Well, that was another great Pilates video. I absolutely encourage anybody who hasn't tried Pilates, do try it. It's great for flexibility, very much about the core. The machines are not nearly as intimidating as they look, and it's really a lot of fun. We also had a nice ad there from Assisting Hands, and I'd like to take just a moment to acknowledge all of our sponsors. We've been sort of talking about this throughout the day, but I want to make sure that they all get a shout out while I'm speaking here live. So for our major sponsors, we had a number of companies really step up and support this fair in a major way. Artis Senior Living of Lexington, Assisting Hands Boston Northwest, Beth Israel Lahey Winchester Hospital, Excel Orthopedics, Home Instead, Melrose Wakefield Hospital, and the Visiting Nurses and Community Care. And fortunately, we've heard from most of them today during the live stream as well. And I hope that you've had an opportunity to see them in their booths. Other sponsors of the event are Wegmans, and we're about to have a nice segment on nutrition, so I'm looking forward to that. And Ohm in the Office and Johnson Compounding Pharmacy. So all the way back at the beginning of the day, we had Glenn from Johnson Compounding Pharmacy telling us about how individualized a compounding pharmacist can make your COVID care. So, but next up, I'd like to introduce Vula Manousos. She's a registered dietitian, and her business is called Nutrition Design with You in Mind. And she has a presentation for us. So please, Vula, tell us how to de-stress through food.
Excellent. Thank you so much, Erin. So welcome to the 4 simple steps to reduce stress and kickstart your energy weight loss journey. Do you know that 27% of adults say they eat to manage stress? 30% of those who report overeating due to stress say the behavior is a habit. End result, unwanted weight gain, fatigue, more stress, vicious cycle of stress eating, feeling guilty, going on a diet, like a low carb or keto diet, ultimately leading cravings, weight gain. Hi, I'm Vula Manousos, registered dietitian and licensed nutritionist with Nutrition Design with You in Mind. Put this talk together because nowadays, especially with the pandemic, too many people are struggling with this vicious cycle of stress and weight gain and exhaustion. I'd like to talk about how stress and emotional eating is leaving you with low energy, completely spent, overweight. You may find yourself eating more high-fat, high-sugary foods when stressed. You don't know why. Life happens. You enter that vicious cycle of emotional eating throughout the week. It leaves you drained, hopeless, and unhappy with your weight. So you're in the right place today if you're sick and tired of eating your emotions when anxious and overwhelmed. You're also in the right place if you're completely fed up with eating comfort or junk food that leaves you guilty and tired with very low energy. You're also in the right place if you are tired of the weight gain from unhealthy eating patterns due to the stress that you don't know how to handle. So what we will be covering today is how to identify and manage your stress eating so you are not left exhausted, guilty, and overweight. And a bit later, we'll tell you how to take a deeper dive on how to really master what we're exploring today at no cost to you, which is something that I'm very excited about. I would like to start by telling you a little bit why I feel so passionate about helping people manage their eating and their weight with a non-diet approach. I spent the greater part of my 20-plus year career counseling people on healthy eating, only to realize that anyone who was on a diet would fail. They would lose the weight, then they would gain it back. They would feel guilty and a complete failure, only to go back on the same diet or another diet that didn't work for them. My goal is to help people move away from viewing food as the villain and learning the skills to enjoy eating without guilt and shame, while boosting their energy levels and managing their weight through their food in a peaceful manner. In my work with my private clients, I do a thorough assessment of current eating practices and how we can get them from an emotional eater to a more thoughtful one that is able to pay attention to their own hunger, fullness cues, and let that be their guide so that they are fully present and aware of their eating. I also teach them how to plan out sustaining meals in a way that is quick and easy without the hassle. Now, let's talk about why people overeat. With persistent stress, there's a secretion of a hormone called cortisol that is linked to increased appetite. This hormone can be found to be significantly higher in overweight versus healthy weight women. The root problem, you might ask? Well, the first step is to recognize your stressors that may be triggering stress eating and deal with those head on. Here are the 4 things that can help manage stress, help decrease overeating. Please feel free to pick one thing to work on. First, when you've mastered that, then you can continue on to the next. Again, we're reviewing 4 steps to get you closer to a more engaged, less emotional eater. So let's get to it. The first step is diet. Of course, a healthy diet affects mental health. It can actually help decrease your stress level, build up your immune system, level your mood, decrease your blood pressure. Lots of added sugar and fat can have the opposite effect. Junk food is more appealing when you're stressed, so you end up eating more of it. What can we do instead? Well, we can try to eat leaner proteins. We can also try to add more complex carbohydrates to our diet. We can incorporate more fatty acids, which are found in certain fatty fish. We can also boost the antioxidants in our diet, which really help protect your cells against damage chronic stress can cause. Examples of antioxidants in foods are in berries, beans, nuts, dark greens like kale, collards, as well as ginger, even dark chocolate. Nutrients that can decrease stress are vitamin C, magnesium, which is found in nuts, seeds, greens, beans, whole grains. Again, those great omega-3 fats. Second step, get you to become a less emotional, stressed out eater, is to exercise. And I know we've had many different presentations today about different forms of exercise. What exercise can help you do, and I'll be talking a little bit about this in a moment, is it really helps you sleep better. Better sleep means better stress management. It helps renew the body and the brain. It also helps with mood. When you exercise, you release these feel-good hormones called endorphins. Block pain, improve your sleep, actually help sedate you. This in turn makes you feel less anxious, more positive about yourself. The third step, which I just referred to a moment ago, is sleep. Sleep is actually a huge component or piece of this puzzle. A side effect of stress can lead to overeating is the lack of sleep. This can lead to increasing the stress and cortisol levels in your body. What can we do to help improve our sleep? Well, we need to practice better sleep hygiene. Less alcohol and caffeine before bedtime would help as well. Getting out into the sunlight, especially on a day like this, maybe after this virtual fair, we can all go outside and enjoy the sun. Really reducing and minimizing the electronics and the blue light 60 minutes before bed. Also keeping your bedroom at a cool temperature. 60 to 65 degrees is usually the right temperature to kind of get you in that sleep mode. The fourth step in our series, relaxation techniques. The first one I have for you is yoga. Stretching, deep breathing with yoga decreases anxiety and stress. Another thing you can try, meditation. This is proven to decrease stress and anxiety, as well as chronic pain, which improves sleep, energy, mood. Meditate. It doesn't have to be complicated. You can find a quiet space, whether it's at your desk or in your home or in a room somewhere where it's quiet. Comfortable. Wear some comfortable clothing. Focus your attention on a word, an object, maybe your breath. You can also try deep breathing. When you practice deep breathing, turn on your body's natural ability to relax. This leads, to a state of deep rest. It can change how your body responds to stress. It also sends more oxygen to your brain and calms the part of your nervous system that handles the ability to relax. Another thing you can try is belly breathing. Deep breaths in through your nose, exhale through your mouth while paying attention to how your body is relaxing. Doing this 4 times when you are in a pinch, at your desk, in your car, in a stressful situation can actually help calm and relax you. So, managing your weight, reducing your stress eating is completely within reach with these 4 easy steps. Rein in that emotional eating by understanding your triggers and taking charge on how you address them. You can do this. I've seen people completely shift from stress eating to more peaceful, sustainable eating, and who've been successful at managing their weight, boosting their energy, just feeling great about themselves. I am now going to share the exciting opportunity that I mentioned earlier. I'm happy to be able to offer 7 people a special non-diet approach to mindful weight loss breakthrough session the next 2 weeks. I usually don't offer these sessions in my practice. If I did, it would be valued at $200. Because you're joining me here today at the virtual Health and Wellness Fair, I am currently gifting these sessions. In these sessions, you will discover what may be holding you back from achieving your goals, managing your weight, boosting your energy, eating peacefully for life. We will create a plan to help get you to move forward in achieving your weight and health goals. You'll leave the session inspired and motivated to take control of your eating and your overall health. So all you have to do to put your name in the hat is email me, Voula, V-O-U-L-A, at mynutritiondesign.com. So that's Voula, V-O-U-L-A, at mynutritiondesign.com. I am gifting 7 of these sessions, not to the first 7, to people who are really determined to change and get to their goals. You also need to be available in the next 2 weeks in order to receive this special session. So in closing, I would love to leave you with a thoughtful quote from Charles Eisenstein. We overeat, not because we enjoy food too much, it's because we don't enjoy it enough. If you would like to get a taste of my work, please consider joining my bi-monthly Facebook Lives. They're on Fridays at 7 p.m. on my business page, Nutrition Design with You in Mind, LLC. One is my Table Talk with Voula, which is an educational, interactive nutrition series. The other is my Let's Do Dinner series, where I whip up quick and easy meals without the hassle. You can also visit me on my webpage at bit.ly/mynutritiondesign. Thank you for your time. Please visit me in my virtual booth if you have any questions. Erin, any questions in the chat?
I have questions. I don't know if we have. I don't know if we have any questions from the audience, but no, I do. So I can tell you right off the bat, here are my 2 big excuses, right? 1, I don't have time. I don't have time to cook something that is better than swinging through McDonald's and grabbing a cheeseburger.
Okay. Yes. And actually, it's very interesting that you say that because I love bringing this up during my lives. There's a Kentucky Fried Chicken that's literally steps away from my house, and I need to go buy it in order to pick up my daughter from her gymnastics practice, and it just blows my mind. There's a line that's all the way up the street and back again. And it really pains me because people are eating this food. They're probably getting indigestion. All the fat is just making them tired and lethargic. And no, there's a way to do it, really. I mean, there has to be a little bit of planning, okay? And that's kind of what I educate people on. How do we get you a menu plan for you, for something that makes sense for you? I don't use a cookie cutter approach. Everybody is different. Some people work, some people don't. Some people are trekking kids around. Some people do both. So how do we get you to do this in a sustainable fashion that you're able to actually maybe get some traction with this? And, I don't expect people to do this in one foul swoop, right? It takes, one step, one foot in front of the other, right? So once you've got, the menu planning down, or maybe the shopping list, we'll work with you on a shopping list that you can bring to the groceries to prepare quick and easy meals, maybe twice a week. Then, maybe you make more food so you have leftovers for lunch. So all of a sudden it becomes 4. So I really do a lot of hand holding around that kind of work as well. It doesn't happen overnight, Erin.
No, that's excellent. No, that's excellent. All right, here's my second excuse.
Okay.
People have tried to work with me, Vula. I'm impossible.
Oh no. I don't believe that.
Here's my second excuse. Okay, this all sounds great. Let's say we plan a menu and I agree, shopping list, and I can handle this and I can find the time and all. Okay, great. We get to that stage.
It's not too much time. Okay, yes.
And then, well, nobody else in my family is going to eat this. I have a whole family of picky eaters and I don't want to cook just for myself. But then what if they're not eating it?
Right. Yes. And I do encounter that. And actually, I'm working with a client currently who has a very picky eater. Okay. And she's like, listen, I'm going to eat this. My husband will eat it. The kid's not going to eat this. Right. So we kind of try to break it down. So maybe using the components of what you're cooking. So maybe if you're making a chicken salad, with grilled chicken and pomegranates and different things that maybe you and your partner might enjoy. Well, the kids are not going to eat that. So I'll tell people to take that chicken, you've already grilled it, it's part of your menu, okay? Then maybe put it in a quesadilla. Maybe you have those wraps ready. That would be part of the work we'd be doing together. Okay, so what do the kids like? And that's something I'll ask. Even though I'm working with you, I will ask you some questions about the family so I can try to weave it through. Right. What we'll do is make a quesadilla with some cheese. Got shredded cheese on hand. You've got the wraps. We can do whole grain, or we can do the white flour or the corn tortilla. Remember, all foods fit. Okay. We're not going to get into this. Oh, it all has to be whole grain. Well, the kid's not going to eat it. So you know what? Let's use that whole, the white flour, the corn tortilla. You've already grilled the chicken. Let's throw it in the quesadilla. All you have to do is warm it up. It takes 3 minutes. So now you and your partner are having the lovely, salad with the different components that, I've suggested. Right. And then your daughter's having little quesadilla, and maybe she'd be interested in having the cherry tomatoes that are in the salad all around her plate, because that, in a smiley face, so there are ways to do it. Right. So it's time.
Okay. My husband's going to kill me, but he's the picky eater.
Oh,
I have the only New Englander who doesn't eat seafood. So I don't know what to do with that.
Okay.
My children will eat fish. My children will eat vegetables.
Okay, but your husband won't eat the fish, and that's something you would want to have maybe twice a week, let's say.
Yeah.
So I would probably ask you and say, all right, what does your husband enjoy? Tell me. So you'll say, I don't know, why don't you tell me, actually?
Well, beer, but that's not,
Well, not before bed, remember.
Yes. Well, no, he likes red meat and he likes chicken. He likes very traditional kind of American comfort food, especially, from growing up, shepherd's pie and mac and cheese and that kind of stuff.
Yes. And by the way, I am having a live on the 26th, and I'm making an Irish dish. So there will be red meat, there will be beer. So you can tell your husband to tune in. All right.
All right.
So I've cut some corners so it's healthier. Some vegetables in it. It takes a little more than 30 minutes, but it's one of those meals that you can freeze. But again, what I would do with somebody like that is say, okay, listen, Erin, you're going to want that fish. So you've bought the cod, and this would be part of our menu planning, right? So you would have already told me, my husband doesn't eat fish. The kids will eat it. We're cooking for 4. We got 3 eating cod, 1 eating beef and chicken only, or just beef and pork. And again, listen, he is not my client, so I can't really fine-tune things for him.
Right.
What I would recommend is, as part of your shopping list, when you're doing the fish 3 times a week, maybe we can add a piece of leaner cuts of steak. And I could tell you, a prime rib is not the leanest cut, right? So we want to be mindful and thoughtful of his health as well.
Right.
And kind of steer you to maybe cooking that for him maybe once or twice a week. And how can we incorporate other leaner proteins for him as well? Something that would maybe be the same cooking method, so that it's not kind of in tandem instead of, I have to make another meal.
Yeah.
And maybe your husband would eat the salad. It's the fish he's not going to eat. Maybe he would eat the couscous or the mashed potato. He really won't eat that cod. So again, trying to work the, kind of in the framework of what the family needs are, because that is very important. You're absolutely right. I'm not a short order cook either, right? So I cook all the time, but I tell the kids, this is it, and you can pick from it and you can eat around it. But it's hard. I do understand, but it's getting creative, and that's my job. My job is to create something that works for you and your family. Absolutely.
I appreciate that so much.
Yeah.
Thank you. So are you going to be back in your booth when we're finished here?
I absolutely am.
Okay,
So if anybody has any questions or comments, or, they can come on in and visit me there. Absolutely. I'll be there for the duration.
Excellent. All right. Well, thank you so much, Fula. It was great having you present.
Thank you so much, Erin. It was a pleasure.
All right. Next up, I think we're going to have a video from Artis Senior Living in Lexington. We did run this kind of back at lunchtime, but we want to make sure that we get that in here as well.
The Artis Way in Action allows every individual, every resident here, a chance to be who they are. We try to find out things that they enjoy doing the most, and we seek to respect them and treat them as an individual and as an adult. We encourage friendships, and we encourage purpose, and we just encourage them to be who they are and to be the best they can be.
You want to go somewhere and know that you have friends or you meet people, but you still can be on your own to do what you want to do.
The A for Artis stands for the ability to have a voice. And we have a resident named Dan who came here as a pretty upset man. His children, his 2 girls, were concerned that they couldn't find a community for their dad that would allow him to enjoy his love of the outdoors and to take his daily walks. So when they came to Artis, he was depressed and very withdrawn. And over the course of the last few months, he's been able to have his voice heard. At a town hall meeting, he talked to John about being able to be outside and walking, even if the weather was a little bit inclement.
I like to be outside, yeah.
He loves to walk here, I do believe, because I feel like that's his choice, it's his decision, nobody's stopping him. They let him walk out the door pretty much when he wants to. So it's pretty much as close to independence as he can get right now.
We also have had fun watching him develop some friendships as he's enjoyed his walks, and he and Bessie are out here a lot, and that's been a fun relationship to see blossom as well.
He has that quick wit and great sense of humor that my family and I have not seen probably for 2 or 3 years. And to have that piece of my dad back again is one of my favorite things since he has been here. It's almost like we have Dad back, and it is wonderful.
The R in Artis stands for respect and maintain relationships. We have 2 families here that have had a really fun story in that Al's daughter is married to Asta's son. Al was our resident first, had moved in here after several other communities didn't work for him, and really excelled here. And when Asta's family saw that, they decided this would be a good place for her to come as well. So they already have many years as a family together, but they've been allowed to continue that here. And the families have intertwined and have really been able to stay in touch a lot more and seen both their loved ones really come to life here.
Did you raise them in your backyard, Asta?
I had some flowers.
They care for each other, again, from a long relationship of being family friends. And I think my mother has a lot of high esteem for Al because of the kind of man he is. So it's a very warm relationship.
The T in ARTIST stands for treasuring each person's uniqueness. One of the tools that we use to discover that is a partnership profile that we ask the families to fill out before they come, which gives us a lot of great background information on our residents. And one of the things we discovered about Betty is her love for puzzles.
No, there's still C has to have that little bit of green on it. The stories I hear from my mom about her love for puzzles are the memories she has with her daddy most of all. Daddy always had puzzles. Yeah.
She and her dad used to do puzzles together for many years, and she often talks about that, and those are wonderful memories for her. So she has her corner set up where she enjoys her puzzles, and her daughter comes and enjoys doing those with her. She's completed numerous puzzles that we have been able to frame for her and distribute around the community. Al and his son Tom have a shared love of old cars, and we've heard a lot of stories about Al and his old Model A's way back in the day.
His first car was a Model A Ford, and my uncle taught him how to drive it.
I put my foot in on that clutch and shifted it, and it grabbed. I finally got onto it. It took a while.
And his son Tom now has a Model T Ford that he has brought to ARTIST several times to share with the residents here. And they get to drive around the flagpole a few times and kind of take a ride back down memory lane and have a really good time. The I in ARTIST stands for integrity, which is basically doing the right thing. Integrity for us kind of stretches into just getting people into the right role as well. And for Asta, she came in rather quiet and rather concerned about meeting other people. Even though she was a people person, she took a while to kind of adjust to really into that role. But we asked her if she would be our ambassador and welcome new residents to the community. And she has just been a gracious woman and doing that in just a wonderful way.
Well, my mom has always loved people. She's always got along with everybody. And she's very family oriented.
She's also helped us in our recognition of our different employees throughout the months. And Asta helped us honor our nurses not long ago and very sincerely thanked them for being such great nurses.
Well, I'm very proud of my mother that she's been named an ambassador because she is truly a goodwill ambassador at ARTIST.
The S in the ARTIST way stands for success and recognition. One of the things that we have done that has been a great success has been to include our residents in making welcome gifts for new residents. And one of the best things we've done is to allow them to help us create these beautiful fleece blankets. So we'll have several residents lined up around the table, and they own this job. They are very determined, very focused, and very eager to give it their best to make this a beautiful gift for a new resident. Our very first blanket was done for a Bengals fan. She owns that and loves it. One of the things we have found that has been really fun is to take some of our longtime bowlers bowling again for the first time for some of them in many, many years, and they have really come to life. Dora is another one of our longtime bowlers who has really enjoyed her trips bowling. We've tried to do those once a month, and she's always on that list because she may be in her 90s, but she is a very agile woman and loves, very competitive, and really enjoys her bowling. So to see her get to do that and cheer others on.
Did we ever think we would ever see our mother do anything like that again? Absolutely not. We feel like she looks younger, she acts younger, she is more like her old self.
Huge sense of relief off of my shoulders and my sister's shoulders. Sorry. To know that he is content and happy and safe.
Come on. Knock it over. Knock it over. Come on.
Welcome back. That's such a lovely video. I've watched a couple times now, and I really enjoy seeing that. It seems like such a very positive place. Next up, we have Om in the Office, which is, well, you know what? I'm going to learn more about what it is. It's very exciting. From what I understand, this is a way to bring de-stressing to the office through maybe meditation. Is that right, Laurel? This is Laurel Kilborn.
Hello, Erin. Thank you. Yes, Om in the Office has been around since 2008, and we specialize in working with our corporate partners, our corporate businesses in the greater Boston area, and since the pandemic, nationwide. So we bring a variety of wellness services into the workspace. Now we're doing this 100% virtual.